meeting. Today is the 18th of March 2021, and I can't believe that we've adjusted the budget thrice in this financial year, but it is the sign of the times, and I'm grateful that we are a resilient parliament with a very resilient government as well. I want to start off by welcoming all members, the Minister, the departmental officials, and all of the guests joining us via Microsoft Teams, as well as via the Western Cape YouTube channel. I want to start today, members, by saying thank you to all social workers in this province for their contribution towards providing social welfare services to the most vulnerable in our province. This week, on the 16th, we celebrated World Social Work Day, and I think it's apt that we recognize these individuals who have, during COVID, given so much of their time, and their jobs have been made harder because we have been able to social distance, and we know that social work is not a job that allows for social distancing. I'm just going to remind everybody of the cardinal rules of online conferencing before we move to introduction. If you could all please mute yourselves, and when you are not speaking, please make sure that your mute button is on. And when you do speak, please feel free to use your camera if your internet connection allows it. I understand that some colleagues might be going through load shedding. I know our procedural officer might be affected by load shedding right now, and I hope that that doesn't deter us. Colleagues, we're here today to discuss the budget, but before we do, I'm going to hand over to the members of the Standing Committee to please introduce themselves.
Good morning, Chair, Member Brankes. Thank you.
Good morning, Chairperson, Minister and all members. Wendy Philander.
Good morning, Chair, and Baku Force. Good morning, Chair, to the Minister and to the meeting. My name is Member Makamba Poita. Thank you.
Good morning, everyone. My name is Ricardo Mackenzie.
Good morning, Chair. Good morning, everyone. My name is Ayanda Barnes.
Good morning, Chair. Good morning, everyone. My name is Rachel van Vogel.
I'm now going to ask the Minister and then the HOD, as well as the departmental officials, to introduce themselves, please.
Good morning, Chairperson, honourable members, to all the officials on this platform, and also our guests on YouTube and on the virtual platform. It is a pleasure for us to account to the committee, and I will immediately hand over to Dr. Robert MacDonald, our HOD, to introduce himself and the rest of the team. Thank you, Chair.
Good morning, Chairperson, honourable members, Minister, and the guests from outside, and also the departmental officials. I'm Robert MacDonald, Head of Social Development, and I'll hand over to my team to introduce themselves, starting with the CFO.
Good morning, all members and colleagues, Minister. And dear Chairperson, I'm Juan Smith. I'm the CFO for the department. Good morning.
Good morning, Honourable Chair and Honourable members. I'm Zwande Leo, the Chief Director for Community and Partnership Development. Thank you.
Good morning, Honourable members, Minister and colleagues. I'm Charles Jordan and I'm the Chief Director for Children, Families and ECDs. Thank you.
Good morning, Chair and honourable members. I'm Leana Fussen, Chief Director, Social Welfare and Restorative Services.
Good morning, Chair, colleagues, Minister, and members. I'm Dean Bahali, Director for Finance.
Good morning, Chair, Minister, members and colleagues. I'm Siam Niftahdeen, Director, Business Planning and Monitoring.
Good morning, Chair, honourable members, Minister, colleagues and guests. I'm Ananda Nal. I'm the head of ministry in the office of Minister Fernandez.
Morning, Chair, honourable members, Minister, colleagues. I'm Annemie van Reenen, the Director Operational Management Support.
Thank you very much, colleagues from the Department of Social Development. May I now also ask that our colleagues from the WCPP also introduce themselves?
Good morning, everyone. My name is Ben Daza. I'm the Senior Procedural Officer for the Standing Committee. Thank you.
Welcome, Charles. I'm sorry, Clarence. Mr. Issa. Do we have anybody else from the Western Cape Provincial Parliament meeting? Okay, I'm hoping that Nomonde is in the meeting because I know that she is having load shedding today. So Nomonde Jantre is our procedural officer for this committee. I'm also now going to ask, are there any external guests joining us today?
Good morning, Chair and honourable members. Teresa Edelman from the Black Sash. Other colleagues of mine from the Black Sash will be joining shortly as well.
Thank you very much and welcome, Ms. Edelman. It's always very nice to have the Black Sash with us. Nomonde, I'm going to ask, are there any apologies for today that I might not have received that you may, if you are on the platform? Nomonde, I can't hear any sound from you. Can I perhaps ask that if you can just email me those apologies, or if you can send it to me via WhatsApp and we will note them. Colleagues, as you know, today's committee engagement is a meeting and a public hearing. It is the first part of the meeting today. The committee is going to deliberate on vote 7, social development, in the schedule to the Western Cape Third Adjustments Appropriation Bill, and that's Bill 3 of 2020-2021 financial year. After the department has finished reporting on this third adjustment, which is quite a short one, the members will be allowed to ask questions on the third adjustment. And once all questions have been answered by the department, I will then also allow members of the public, if they'd like, to ask questions and make any submissions if they want, and the department will have an opportunity to respond accordingly. What I'm going to do, members, I'm going to hand over to Minister Fernandez to give brief remarks on the third adjustments appropriation. I'm going to ask the minister to keep it short since it is quite a short section, and that is in our budget books starting on page 35, all inclusive of until page 39, which includes the annexures as well. So I'm going to hand over to the minister, and then also afterwards, if the HOD, Dr. McDonald, would like to also make some input, they're welcome to do so.
Good morning again, and thank you, Honourable Chairperson, members, guests in the gallery. Little did we know, I think it was just over a year ago that we convened in the chamber, not knowing what the year ahead had in store for us. And when we reflect on a year of COVID-19, we are here to talk to the third adjustment appropriation estimate. It has been an incredible year, but it's also been an extremely taxing year for social development specifically. As you said, our social workers are frontline workers, and they were the first responders in the face of a brutal onslaught of a first and second wave. Coming back to the budget, though, for the 2021 For the 21-22 financial year, the department received a budget of 2,663 million. This is 29.237 million rand less than the current financial year's revised estimates. Whilst the year in comparison reflects a decrease in the budget of 21-22, it is important for the committee to note that the once-off expenditure received in the current financial year, and here I refer to the ECD stimulus grant of 53 million and the food relief which we received from the National Department of 51 million, were once-off allocations and they are not provided for in the new budget. The declaration of a state of national disaster and the phased lockdown response to the COVID-19 pandemic has precipitated shocks to an already ailing economy and further heightened the impact of many ills affecting Western Cape communities. Chairperson, as you know, it's a subject that's very close to my heart, but I'm not going to stray and talk to the fallout, but I'm certain we will have an opportunity to deliberate on that. The department was not immune to these economic shocks, as austerity measures in the form of budget cuts intensified and necessitated that the department reprioritize its budget to provide support to NDOs facing downsizing and job losses, humanitarian relief in poorer communities, and deteriorating safety levels fueled by increasing gender-based violence. So with this as a backdrop and taking its lead from the Western Cape Recovery Plan, which focuses on 4 key anchors, our focus is specifically on the well-being and safety priorities. We will be this year in 21-22.
Minister Fernandez?
Yes, Honourable Chairperson.
May I ask, are you still on the third adjustments, or have you moved on to the budget for the financial year 21?
Sorry, Chair, if you would indulge me, I'm just doing an overall introduction, so we covered, if that's, I've got 1 paragraph to go, and then I'll be done. My apologies.
Okay, because I do have another slot for you as well in the next session.
Okay, well, it was really just what I was going to talk to was the budget focus going forward in 21-22, but our adjustment is minimal, so I'll hand back to you, Chair, and then we can pick up from there. Thank you.
Thank you, Minister. Dr. McDonald, is there anything that you'd like to add on the adjustment budget?
Thank you, Chairperson. I think the Minister's spoken to the context, but the adjustment itself is only an adjustment of one amount, which is 3.205 million, that the department has asked that Treasury take and provide to the department in the new financial year to assist with the cost of early retirements, the penalties associated with that. So that is the only adjustment that we have in the third adjustment, and it's set out on the in the Note 7 section of the book there, and you'll see that one amount. So it's a fairly simple adjustment, and it relates to compensation of employees funding. Thank you.
Thank you very much, Dr. McDonald. Members, I'm now going to put it to you. If you have any questions on that 3.205 million that is being moved over to the new financial year. I see Member Mackenzie. Can I get an indication if there are any other members before I hand to Member Mackenzie? I see no other members. Member Mackenzie, you may go ahead.
Thank you, Chairperson. If we can just get details, because Dr. McDonald said now they've asked them, if I heard correctly, to use it again next financial year, if I heard that correctly. But anyway, I just want to get details onto why are we surrendering these funds. I understand it says here due to COVID-19, but it doesn't mean anything to me. Could we not recruit the people? Was the post? Can we just get details as to why we're surrendering these funds?
Okay, I'm going to hand over to Dr. McDonald, but if I heard correctly, Dr. McDonald said that this is money that is being given back to the provincial treasury, and it will be added to the next budget, and it's for early retirement in terms of cost of compensation for employees. But Dr. McDonald, you might want
Yes,
to
but we
clarify
didn't know why. Yes, thank you, Chair.
Okay.
Thank you very much, Chairperson and Honourable Member. During the financial year, with the lockdown period, there was quite an extended period during which vacant posts were not able to be filled because of all of the processes required both provincially and nationally were offline. So there was a bit of a backlog of filling posts, which resulted in some savings in the compensation budget. One of these strategies that's been put in place in the province to try to reduce the compensation bill is to institute a offer on the part of the employer to employees who are interested in taking early retirement, who are close to retirement already, with the proviso that the department pay the penalties for those early retirements. And so the idea is basically that we were going to pay the penalties to allow for quite a number of people who are taking early retirement to do so. The early retirements were initiated during the current financial year, but the actual payments will only be made in the new financial year. So hence the request that that money be rolled over to be paid when the retirements go through.
Thank you, Dr. McDonald. Are there any other questions from members on the third adjustments?
Chairperson?
Yes, Member Mackenzie?
Chairperson, if we can ask, and I've raised it also at another committee, that perhaps more detail can be given in the future, because there seems to be a line in quite other books as well, is due to COVID, due to the pandemic. Now, we're not privileged to be in 4 or 5 years from now to have those reasons. If they can just be much more detailed, like Dr. McDonald explained now, if possible, just so one can get an understanding as to the reasons, therefore. Thank you.
Thank you very much, Member Mackenzie. So there's one recommendation so far, that in future we just expand a little bit more in the budget books so that we understand the reasons behind as well. I don't see any other members. I'm now going to ask our colleagues from the Black Sash or any other member of the public that's online, if you would like to pose a question or make an input.
Not at this stage, Chair. Thank you.
Thank you very much, Ms. Edelman. Colleagues, I'm going to give members just a last bite before we move on, just to make sure that I've given everybody an opportunity. Are there any other members that would like to ask a question on the third adjustment budget, pages 35 to 39, all inclusive? I see no hands from members. Thank you very much for that. We're now going to move on to the second session of our meeting. And I'm now going to hand over to Minister Fernandez if you'd like to expand more on the opening remarks that you made earlier. And we're now going to move on to vote 7, social development in the schedule to the Western Cape Appropriation Bill, B4 of 2021-2022 financial year. And I'm going to ask the Minister to make her opening remarks. And since the Minister started already, I'll ask the Minister to keep it to under 5 minutes. And then I'm also going to ask Dr. McDonald if there's anything that he'd like to add to what the Minister said. Minister, over to you.
Thank you, Honourable Chairperson. I'm always quick at the blocks and I like to cut to the chase, but I must, in terms of the budget, it was a very, very difficult exercise for Provincial Treasury and for all departments. And we are seemingly a smaller department, yet we render equally valuable work. However, I think the budget allocation was a challenge in that we were competing for resources, and we needed to ensure that we spread it sufficiently so that every department could fulfill its statutory mandate. So with a severe fiscal environment that we're operating in, which I must add existed before COVID-19 hit our shores, we are experiencing a huge shock in the sense of funding. We are experiencing donor fatigue in our sector, and we are starting to see an implosion, if you could call it that. But our focus during the 21-22 financial year as a department will have to be on maintaining the delivery of statutory and court-ordered interventions. That is the bread and butter, the core work of the department. We will continue on the institutionalization of the integrated Isabindi program. As was highlighted during COVID, we will continue our humanitarian support, relief support to communities, and that fits squarely in the well-being leg of the relief plan, which talks to dignity and well-being of our citizens. Support to the homeless. This is a phenomenon that, as we have seen, an exponential increase in the number of homeless people, not only within the metro, but across the province and the country, and globally. It has become a phenomenon that has attracted attention. So we will be looking at funding additional bed spaces, and also the very important work of reintegrating the homeless with their families as far as we possibly can. We remain focused on combating GBV. As the lead minister for GBV, we have established a transversal based violence work group, and that work is taking place and is happening. We are busy finalizing our provincial action plan. We were blessed to receive 6 properties from National Public Works. I remember the media release was on the 4th of March last year, and it's taken us virtually a year to get up and running in terms of all the background work. But I'm pleased to announce that I will be opening 1 shelter before the end of this month, and the other 5 will come on stream as quickly as we can get them compliant in terms of health and safety and security measures. We will continue to focus on provision of PPE to both our NGOs, ECDs and staff. And we're going to have to improve leveraging and coordinating across service delivery areas and transversely across spheres of government. And then finally, Chair, the focus, despite this being a fiscally constrained budget, we will still continue to focus on filling our priority service delivery posts, which arise as a result of resignations, deaths, and obviously new jobs coming online. So that, in brief, is the key focus from me. I keep a finger on the pulse. However, Dr. McDonald and the finance team will expand more on our Vote 7 budget for the 2021-2022 year. I thank you, Chairperson.
Thank you, Minister Fernandez. Dr. McDonald, over to you, sir.
Thank you very much, Chairperson. In terms of the budget strategic context, I think the Minister has set out the main overarching themes. There is very much a focus on putting some additional resources into the area of the COVID recovery plan as being the main focus for additional allocations. We have received an additional amount of 25 million from the Provincial Treasury for food relief as one of the priority areas that we are supporting alongside SASA with the COVID grants and alongside civil society and some of the municipalities that are also providing food relief because of the increase in hunger and increase in joblessness that has been associated with the COVID crisis. There is also some additional funding that has been put in our budget. Treasury has given us 10 million additional for some of the other priority areas, including the homeless shelters and the need for additional bed spaces, given the large increase in the number of homeless adults on the streets. And then also there's been some additional amounts for GBV and for child protection services, particularly to align with the safety priority areas where we want to bring in some additional capacity there. So those are the main areas where there have been additional allocations made. But in the main, our budget is not a major increase from the previous financial year. In fact, as the ministers noted, with the fact that some of the once-off allocations that were made last year by the national sphere as well as the provincial treasury, there is actually some reduction. The biggest concern, I think, as the minister flagged, is the fact that because the budgets are somewhat flatlining at this stage in time, the amount of money that the department can provide to the NGO sector to support the NGO rendered services is not increasing much or at all in most cases. Usually we try to be able to give at least inflation-related increase to the funding that we provide to the NGO sector, so that their services can keep pace with increasing cost pressures. But given the fact that the budgets have been kept as they are, we are now not in a position to do that, which does concern us because it begins to impact on the sustainability of the NGOs at a time when they are also suffering from, in many instances, less income from donors as the private sector begins to feel the pressure of the COVID-induced recession. So I think that that is a major area of concern for us, which will be not only affecting this year, but more so even in the 22-23 financial year and the outer year. And only then Treasury is predicting that revenue nationally will begin to improve, and we will then start to get ourselves out of this this situation where the funding is not being able to be adjusted upward. We also are awaiting the outcome of the court matter relating to the public sector wage agreements, which may also impact us. So at this stage, the budget has been tabled without any increase for the public sector wages, the COE, that would have normally have been included if the wage agreement that was previously reached between the Public Service Administration Minister and the unions was still being applied. So that potentially could become an area that shifts later. But I think those are some of the big overarching issues, and I'm sure we'll get into all the detail after that. Thank you, Chair.
Thank you, Dr. McDonald. Members, I'm now going to ask you to please indicate if you would like to ask questions on the overview that Dr. McDonald and the Minister has given us. I see Member Mackenzie. Can I get an indication if there are any other members as well? Member Mackenzie, you may go ahead while we wait.
Thank you, Chairperson. Chairperson, one, if we can just get details of the one center that the Minister is launching at the end of this month. And then second, if we can get details on the 5 that she's launching from the 1st of April onwards. And then the third question is on the homeless, because I've also seen it in the report, and we get to the technical detail later on. And is there a partnership with the City of Cape Town on dealing with some of the issues that homeless people face? Because I know that they also have a lot of focus on that. Because as obviously I saw in the report, there's no public-private partnerships with the department currently. So what is if there is a partnership, if you can just share those details so one can get an understanding that what the department doing in the province itself and what the City of Cape Town, with the majority of the 68% of the people living in the province, what are they working together, and what are some of these partnerships? And on the services that the city is providing in the centers, I'm talking about the GBV center, so not the city, the province. Again, similar question, are we working with the City of Cape Town? Is there partnerships to leverage some of the work they're doing so that there's no duplication in some of these? And then the third question I'll get to when we get to the page number. Thank you, Chair.
Thank you, Member Mackenzie. Minister, I'll hand over to you. And then after that, we'll recognize, or maybe Minister, before we do, can we recognize Member Brunkhuis? He's just put his hand up. Member Brunkhuis, do you want to go before the Minister?
Yes, thank you, Honorable Chair. Thank you. My question is also to the Honorable Minister, that regarding the shelter that will be opening soon. What is what will be the daily charges that they will be charging the homeless to overnight at these shelters? Thank you, Chair.
Thank you, Minister Fernandez. We'll hand over to you now.
Thank you, Chairperson, and thank you to the honourable members for the questions. I will just deal with the GBV component, and then I will hand to Dr. MacDonald. The 6 properties are located in outside of the metro. They are on the west coast. They are in Hessequa, one in the central Karoo, one out in Heidelberg. But we don't normally, in the interest of the women's safety, we don't normally give an exact location. So except to say that we have received the 6 properties. They were normally old government buildings like magistrates' courts or something that might have been converted. So the one that I will be opening on the 26th or thereabouts of March will be in the central Karoo, where there is no safe house. Since I joined in 2014, that was one of the key areas, and I'm pleased to say that this is one of many needed safe houses. So we have a service provider. We work very closely with the National Women's Shelter Movement and the Western Cape Women's Shelter Movement to ensure that our norms and standards are maintained across our shelters. And obviously there is collaboration with the onboarding of these 6 new shelters as we add them to the other 19 which we already have. Just in terms of our relationship with the city from a homeless perspective, Dr. Badruddin and I host a bilateral meeting on a monthly basis with all officials present, and we talk to the burning issues and the greater collaboration that is required regarding the homeless. However, we also maintain very close contacts with the districts because as part of our recovery plan, homelessness is one of the themes in the dignity and well-being work stream, which I lead as the lead minister. The other 3 ministers are Ministers Mayor, Schaefer and Marais, and Dr. MacDonald leads that work stream. So we try to look at homelessness holistically, and we are seized with a piece of work which hopefully we'll be able to bring to fruition sometime soon. But it is a very challenging space which is not only limited to the metro, it does affect our rural district municipalities and smaller municipalities as far out as Maritzburg. Chairperson, on that note, I'll hand over to Dr. MacDonald to continue with homelessness, and I think there was a third technical question. Thank you.
Thank you, Minister. Through you, Chair. The question about the partnership with the City of Cape Town, the City of Cape Town does participate in the Wellbeing and Dignity workstream engagements that we have, and we work in terms of sharing information with them and making sure that we synergize our efforts and don't duplicate as far as possible. The city also, we do co-fund certain projects with the city. For example, in one of the Central Improvement District projects for homelessness, we are co-funding some of those things, and also some of the shelters. But I think at the moment we are in discussion with the city about their revised homelessness policy. And we also form part of the homeless committee that they chair, but that we also participate in. So we work very closely with them on this particular area of service delivery. But I think it's a tricky area of service delivery because there's not any clear legislation setting out roles of different spheres of government when it comes to addressing the issue of homelessness, but rather it is a cross-functional area that touches on basic service delivery, environmental health, bylaw enforcement, welfare services, housing, and criminal justice. So it's quite a complex issue that doesn't really speak to just one department as such, or one sphere of government for that matter. So in terms of the work we're doing at the moment, the main aim from the Department of Social Development is to try to at least increase bed spaces. We are also discussing with the shelters the question of the amounts they charge the homeless a nominal fee to stay the night as part of a co-production model where they look that they expect the people who stay at the shelters to make some kind of contribution. But to us, we also think that this is maybe a barrier to some of the homeless accessing the shelters. So we're looking at how we can get away from that. The shelters are also saying that at this stage they do need that additional money to continue operating. So we're looking to see how we can assist them so that they don't need to do that. But these shelters are all NGO run, so we are mindful that we need to work collaboratively with them, and we can't necessarily just dictate to them. They're also not a service that we regulate in the way, for example, we regulate children's homes. In terms of GBV, I think the Minister has already mentioned that to some extent, but the partnership with the city is also driven through the transversal structures that we have set up for the COVID recovery plan, as well as particularly in the area of safety and in the area of well-being and dignity. So we do work with the city and the other municipalities in coordinating our efforts in this respect. And we have got a very good working relationship between the officials in the Department of Social Development and the officials in the city's departments of early childhood development and social development on these kind of projects. Particularly, for example, the family support services that the city renders through the Strengthening Family program, and also the Women in Rental Stock program, and so forth. So we do work quite well with the city's departments in that respect. The question from Honourable Member Brunkhuis pertaining to the opening, the shelter that the Minister's opening and the daily charges. There are no daily charges for the shelters for women who are victims of gender-based violence. It's a service that we fund fully in terms of that cost, although the NGO does also fundraise to supplement the money we give, because the amount we give isn't always enough to cover all areas, although we do cover as much as we can. And in terms of the sites that were, as the Minister mentioned before, we don't want to necessarily give the street addresses of those sites, but the site the Minister is opening is in Laingsburg, and the other sites that are soon to be opened as well is Albertinia, Aurora, 2 in Aurora, and Heidelberg and Mariasburg. Thank you very much, Chair.
Thank you very much for that comprehensive response, Dr. McDonald. I see Honourable Member Rachel Windvogel and then Honourable Member Mackenzie. Member Mackenzie, can you indicate if that's a follow-up or if it's a new question?
It's a follow-up, Chair.
Okay, Member Windvogel, do you mind if Member Mackenzie goes first?
No problem, Chairperson.
Thank you, Chair. Just two follow-up questions and then just one comment. Yes, one, don't want the exact addresses of these spaces, obviously. But as the Minister said, we want to, the reason I'm asking the question is, are we covering all our districts? Because we know this problem is province-wide. And then on the homeless question, Chairperson, if we could, and so on the first question, Dr. McDonald, on the regulations of some of these centers, has there been consideration by the department to start regulating them to ensure there's not only oversight, but we can support them better so that obviously ultimately they look after the homeless better? And Chairperson, we can put that on our agenda also for the workshop. I'll make a recommendation. And then with regards to the law enforcement, the city, the province, and I know it's a complex matter. I mean, it must be tough for a law enforcement officer to go to individuals laying on the street who's got substance abuse issues and try to enforce the law. A social worker will probably have a much...
Sorry, Member McKenzie, how many follow-ups do you have?
Just the one more. Just the one more. So if we can get the complexity of what needs to be sorted out so that we as lawmakers can start working on that to ensure that's, that gap is covered. Thank you.
Okay, thank you. Dr. McDonald, can I ask you to respond to that? And then I will give over to Member Windvogel, who's been waiting very patiently.
Thank you, Chairperson. In terms of the question of coverage of shelters for victims of gender-based violence, the 6 shelters are being added to, I think we have around 20 already, but the coverage still is not comprehensive. I think the expansion of GBV services has been quite a recent phenomenon in government generally. In our department, we've been expanding the budgets very rapidly in the past 5 years, but from quite a low base. The GBV services and the shelters particularly, in some provinces they have almost none. I think it may be 1 or 2 that they fund. It's quite a tricky thing because it's not actually yet legislated, and now only we are getting the finalization of the Victim Support Services Bill in the National Assembly, which would then at least start to formalize the responsibilities of various spheres of government and departments in government in terms of the funding of services as well as the frameworks for how those services are rendered. Which is a very good development because I think it's really needed to ensure that this is taken seriously as an area of priority for financing in government, but also so that there is protection to victims in terms of the standards of services and the regulation of the sector. I think there's always been legislation around sexual offences and those things, which is primarily regulated and guided the criminal justice stakeholders. But this is the first time we'll have legislation that is very specific around the services on the welfare side to victims of gender-based violence. So it's going to be a very important step in the right direction. I think also that will then start to also strengthen the imperative for a universal coverage of those services. I think that we still have quite a long way to go till we get to the point where we can say that we have the kind of coverage for gender-based violence and victim empowerment services that we currently have for statutory services like child protection, which we do have services in all parts of the province. That, of course, will take quite a lot of funding. You know, that's something at least we can leverage legislation to secure funding. The question of the regulation of homeless shelters, it wouldn't be up to the provincial department to do that. It's certainly a national legislation that's required potentially. But at the moment, the national departments can't fully agree on whose roles, which aspect of this is. COGTA is saying that social development should be driving it. Social development is saying COGTA should drive it. I think that there's some legal opinions being sought nationally on the issue. Provincially, the department sought some legal advice on the question of homelessness as well, because COGTA and SALGA had raised the issue during the lockdown because of the pressure that was placed on municipalities by the requirement of setting up the temporary shelters under the regulations. Many of the municipalities were of the view that that shouldn't have been done by them. So the issue has been put into the foreground, and we sought legal advice to guide us. And the advice was basically that there are aspects that fall to social development, the welfare side of things, for example, drug treatment services, as well as reintegration of homeless adults with their families, the therapeutic services, and then there's a housing issue, which is more in the domain of the housing department. There is an issue of bylaw enforcement around sleeping on streets, which you're not supposed to be doing, as well as the issue of building structures on streets and building, or rather being on the streets without sanitary services and access to basic services, and the constitutional rights that are involved there. So all of those things fall into the municipal sphere. And then, of course, there's the criminal justice aspects where the homeless violate certain laws, and then the police arrest them and deal with them from that side. And then finally, the mental health care side of things as well, because there is a percentage of people who are on the streets who are potentially in need of psychiatric assistance, which of course falls within the domain of the Mental Health Care Act. So it is complex. Some laws touch on the issues of homelessness from the perspective of their different departmental responsibilities, but there is no definition of homelessness or vagrancy in the South African laws nationally, and there is no department assigned as the lead for that. So I think it would help if there was some regulation or legislation on this, but it would need to come from a national level. Thank you, Chair.
Thank you, Dr. McDonald. Sorry, my mute button just disappeared there for a minute. I'm going to hand over to Member Windvogel, who has been waiting, and then to Honourable Brinkhuis, and then we're going to move on from this section. Member Windvogel.
Thank you, Chairperson. Chairperson, the shelter issue was covered by Dr. McDonald. What I want to know, is there any programs for the homeless people in the rural areas? And then I assume that the same approach, if it comes to collaboration between the department and the city of Cape Town, is happening in the rural areas, or let's say local municipalities and the department. Yeah, that's in short. Thank you, Chairperson.
Thank you. Honourable Member Brinkhuis.
Thank you, Honourable Chair. To the department, if Dr. McDonald can give me an indication regarding the meals served at the shelters, if those meals are, if it is halal food, if there is any Muslims at those shelters. Yes, if Dr. McDonald can just give an indication that the food that is served there at the shelters, it is halal, and what is the sources? Where do they source the food from if it is halal? Thank you, Honorable Chair.
Thank you, Honorable Brunkhuis. And if I could tag on a question on Dr. McDonald, would specific provincial legislation that gives provinces some say in how NPOs and NGOs are registered, governed and regulated, would that help plug the gap? Because at the moment, the way I understand it, the national legislation that governs NPOs puts that process squarely in the hands of the National Department of DSD, and the province only hands out the certificates once it gets to provinces. So if you could maybe just share any thoughts you have on that, and you can answer those other questions as well, please, sir.
Thank you, Chairperson. There are programs for the homeless adults outside of the metro. We have funded organizations across the province. I mean, we also have partnerships with the municipalities outside of the metro area. The municipalities have been participating in our COVID response plan work, as has the City of Cape Town, and they attend the engagements we've been having and make inputs in those spaces. We've also had some bilaterals with specific municipalities around the support to the homeless, because many of the smaller municipalities in particular are battling with it because they've never really budgeted for this area of service before, now found themselves funding the cost of temporary shelters. So that has driven a lot of collaboration and engagement. So yes, there are services outside of the metro as well, but the issue is that the number of homeless adults in the province at the moment is way more than the available bed spaces in shelters. The total number of bed spaces that the province funded last year across the province was 1,500. And as a result, one of the budget items in this financial year is an additional amount that we've shifted of 15 million, 10 million of which came directly from Treasury, and then another 5 million which we've reprioritized internally to enable us to increase the number of funded bed spaces by a further 1,000. So to reach 2,500 funded bed spaces, as well as to increase the number of social work posts we fund at the shelters to assist with the reintegration work. So that is a significant increase for the department given our baseline, but it still doesn't take us to the levels that might be required. There's up to 8,000 people on the street at the moment, but obviously we've got to start somewhere. Given the scale of the challenge, and of course we're not the only ones funding shelters. There are other municipalities, and particularly the city, that are doing the same. So that makes it a complementary effort as well. The other issue, of course, is that shelters in and of themselves are not a solution to the challenge. They mitigate and reduce the harm associated with people being on the street without access to services and food. But they certainly are not an answer. They are a stopgap measure. So the long-term issue is really the economy and the need for job creation, and of course the jobs focus area under the COVID recovery plan is geared towards looking at those things. So there's a lot of EPWP posts being created, a lot of EPWP money going into the economy in the new financial year, which will also create opportunities, and we hope that will begin to also reduce the situation of people being without work and having to go to the streets to try and find something to eat and a place to stay. I think the issue from Honourable Member Brunkhuis about the meals served at shelters and whether they are halal, off the top of my head, I wouldn't be able to answer that in detail, but other than to say that the shelters that we fund, by and large, they accommodate people, the people's needs as far as possible. And I must say, I haven't had any complaints about the food in the shelters. The question we can probably follow up at a later point with the organizations, just to see what their policies are around food, because I mean there'll be halal, probably kosher requirements as well, and I'm sure there's some people as well who have certain dietary requirements, so they do need to be able to accommodate those kind of things. And where they source it from, I think also is probably something that is different for every shelter. So I wouldn't be able to give a breakdown of all of that right now. But I think if the question is put in writing about how the shelters accommodate different religious and dietary requirements, we can probably get some information from the NGOs for the committee. Lastly, with respect to the chair's question about provincial legislation to regulate NPOs, I actually wouldn't be able to tell you off the top of my head whether that's something that would be possible. I think the general principle around legislation between concurrent sphere or different spheres of government around concurrent functions is that provincial legislation should not clash with existing national legislation. So it would probably require some detailed legal advice to guide on that particular question. But I suspect that if we did create provincial legislation for NPOs, the national legislation would still stand as well. So it might end up actually creating a dual process or two separate processes for NGOs, which I'm not sure would be welcomed by the NPO sector at this stage. Of course, if there is a way of making things easier and less red tape, that might be welcomed. But I'm not sure how that would be possible, given that national legislation is still prevailing in this space. But it's a question that I would say legal advice would be best sought on. Thank you, Chair.
Thank you very much, Dr. McDonald, for those responses. Colleagues, I'm now going to table the budget, and I'm now going to table pages 295 to 303 for your questions. If I could get an indication of members whether they'd like to ask questions specifically on pages 295 up until page 303. Members of the Standing Committee on Social Development, are you still there?
Yes, Chair.
I see Member Baku Force. Member Baku Force, you may go ahead.
Thank you, Chair. My question is on page 296. References the third sentence, paragraph 2. An increase in non-searching unemployed has since been observed. My question is as follows. Given that the population growth and high unemployment will have a bearing in the demand of service from the department, I therefore want to understand whether due considerations was given to this a decision to cut the budget for the department was made. And the second one, given the heightened risk of food insecurities and hunger, both in the province, I want to understand what other measures are there to respond to this need, besides the small amounts earmarked for food relief. Lastly, Chairperson, I want to ask if the number of targeted beneficiaries for the department's meals and how many feeding sites and CNDCs have been identified. That's all. Let me go. Can I go on, Chairperson?
Yes, you may, ma'am.
Thank you, Chair. We are still on page 296, paragraph 2, the last sentence. Was it the number of temporary shelters are available and how much is budgeted for it? And the last question from my son, Chairperson, is still in 295, the last paragraph. I want to know, what has been the demand for psychosocial support service in the 2020-2021? Are these open to the public and does the public know about them? And the second question, what work has been done to support families who lost loved ones to COVID-19, particularly those that experience multiple deaths in their families? That's all for now, Chair. Thank you very much.
Thank you very much.
Can I put the last question in 297? The first sentence, Chairperson, I would love to know, do we have stats of children that were murdered and victimized sexually in the last financial year? What measures are put in place to prevent maltreatment of children and protect them from violence and murder? And what is the percentage of this budget that is earmarked for that? Thank you, Chair.
Thank you, Member Baku Force. Honourable Mackenzie.
Thank you, Chairperson. Sorry, Chair, the reason I was a bit slow to put up my hand because I was firstly to ask your guidance. From 295 to 305, can we use some of our questions to refer to the page number, which is much later on, then I deal with that part as well? Is that fine?
That's fine. As long as your questions don't ramble into 15 questions, we'll allow.
I'll keep them under 10. I'm going to start on question number 1. Under program for the year under review, and this reference is made here on page 300 to this CYCCs. And I just want to get an understanding from Dr. McDonald and his team. Has all the services been completely transferred? Is there anything outstanding? I remember from last year, this time, there was still a discussion of services had to be insourced. Has that been done? And is there anything on the previous contract that the department still need to do? From the outlook of the year coming, and here I'm specifically referring to the 25 million rand that's being made available for immediate food relief, if we can get more details onto the how, the where, and the when will that money be spent. For the year under review, and it's got related to the future financial year, for the expansion of the medical staff and the services that we offer, what medical staff are we, or medical services are we offering at these centers? And is there partnership with the Department of Health in providing the services, and similarly with the City of Cape Town Health Services? And my question number 4, with the Dignity Project, and that's also related to page 312 on the allocation to the Dignity Project, if we can just get more details, where, how, and when is this project going to be spent, so we can also inform people where they need to apply and how are they going about it. And Chairperson, a question relating, okay, I can come to that one later because it's a very technical question. And it's one of the, for the year going forward, relating to page 306, under the HIV/AIDS prevention programs. That's program 3.
Mackenzie?
Yeah.
You asked earlier if you can ask your questions on 295 to 303, but reference the pages ahead.
Yeah.
Can we hold, if it's a question specifically on page 306, can we hold that until we get to that section?
Okay, because it's related to page 301, but the actual number is on page 306.
Okay, go ahead.
Yeah, so the actual program referring for the year coming, it's under program 306 with allocation of HIV/AIDS prevention programs. Again, are we partnering? Can you share more details with us so I can get an understanding what services are we rendering? And are we partnering again with the Department of Health and with the City of Cape Town on those allocations? And I'll leave that as not check because I see that you might want other questions. Thanks.
Thank you. I'm now going to hand over to the Minister and Dr. McDonald. If you'd like to respond to those questions.
Chairperson, if I may, I'd just like to preface the work that we do and our four-legged recovery plan, which is a transversal approach to dealing with many challenges. So we have our COVID-19 response, which obviously now is focused on vaccinations. Then we have safety, and within safety, there is a component on interpersonal violence, gender-based violence, and there we are working with external partners, academic institutions, and the Safety Forum, Safety as an advisory board. So there's a lot of work transversely happening within the safety plan, which is one component of the recovery plan. Then within jobs, which is headed by Minister Mania, we understand the significance of employment to the dignity of people. And there are a lot of transversal activities taking place there, bearing in mind that the well-being and dignity work stream, which I lead as Minister Schaefer, as I said, Minister Marais and Minister Meyer. And one of our interministerial committees is that of the faith-based organizations. And we meet with our FBOs once a month, and they have supported us with food aid, food relief. They have also now requested training for psychosocial support, where some of them might have gaps. And they have written to both the city and province to expanding the gender-based violence program. So I think what I would like to just caution or to alert the members to is that we are starting to move away from a single focus, but we are looking at the interconnectedness across the four key themes of our recovery plan. And hence I said up front, the fight or the challenge for resources is what underpins everything. But there will never be enough homeless shelters. There will never be enough shelters for abused women. And so one of our key focus areas is strengthening the family, focusing on the boy child, driving the gender-based violence campaign. But in all of that, we work very closely with our partners that are not only limited to the three spheres of government, but to civil society. Let's give an example of the food relief program. We work very closely with Professor Andrew Borain and the EDP. And there you will find lots of players in the NPO sector that might not work directly with us, but they contribute to that forum. We are engaging public-private partnerships to advance the cause of ECDs, which is likely to be migrated from social development to the Department of Education. So in everything we do it as a collective, looking at a challenge transversely to see how we can all coordinate. And at all these forums, the 5 district municipalities, the City of Cape Town, and external stakeholders are part and parcel of our deliberations, which take place on a weekly, monthly, and obviously a rotational basis. I also want to add that the City of Cape Town councillors and also in the districts, we have reporting mechanisms called hotspot reports, where we provide this information to communities on a virtual platform on a monthly basis as well. So I'll give you an example of psychosocial support. We partnered with an NPO that set up WhatsApp groups for COVID survivors early in March, April last year. And those WhatsApp groups were limited to 15 women. They got their content on WhatsApp, and they went from COVID psychosocial support to gender-based violence awareness, entrepreneurship, and they're expanding their module. So in many cases, we are reliant on our NPO partners who play a critical role in expanding the footprint of a very small team of about 2,500 people to reach every one of the nearly 7 million people in this province. So I just thought to create context, and obviously it will be a conversation for another day where we expand on everything, but I trust that that sets the scene for Dr. MacDonald and the team's responses. Thank you, Chairperson.
Thank you very much, Chair. I think the question from Member Baku Force is partly been covered by the Minister. I think the decision about the overall budget for the department is, it's somewhat out of our hands as a department. There's certainly things we request money for, but we can only get so much of our slice because all of these issues of unemployment and population increase impact on all of the other departments as well. So Treasury's got to balance that between all the departments, and I know most of the departments are feeling the same pressures as DSD is feeling. So it's a little bit difficult for Treasury to try and balance that. I think the challenge is that the actual equitable share amount that we get as a province, together with all the conditional grants, is not keeping pace with the provincial population growth and the challenges that are coming with the unemployment crisis. I think that would probably be true of most provinces. I think also that it's unfortunately with the unemployment and the financial situation comes reduced revenue, and that's where the challenges are. So I think with our budgets, the attempts by National Treasury to make some savings by freezing public sector wages is one of the areas that they've put in place to try and, or one of the measures they put in place to try and ensure that there's as much money available as possible to serve the public. And a lot of money has been put into the support services for the food relief and those sort of things. But of course, the much bigger amounts are actually going to SASSA to cover the COVID support grants, as well as the increases to the other grants. So I think that between the main welfare arm of the state in terms of material support, which is SASSA, and then our services, there's a lot of additional money being put in. In terms of fight and food insecurity, I think the COVID grant at SASSA is an important aspect of that. The other aspect is the money that we've put in this year. We have just released 51 million rands worth of funds or NGO funding to the NGO sector to help subsidize food relief across the province. And now we have another 25 million that has been added to that. So the money that we have already dispersed in this quarter of the year should last up to 6 months in the NGO sector, and then the 25 million that we have in place will then enable us to further extend that beyond that point. I think also it's important to note that the city of Cape Town is also injecting quite a lot of money into food relief in the metro as well. and so together with that and the Solidarity Fund, private donors, the NGO sector, which we're partnering with the Western Cape Food Forum, which is a conglomerate of NGOs that have come together to coordinate food relief, and that alongside SASA are the major measures that are in place to address heightened food insecurity in the short term. But in the longer term, there is also the strategy that's been recently adopted in the province, the Nourish to Flourish strategy, which is spearheaded by the Department of Agriculture, that is looking at long-term food security and with a big drive for communal and household food gardens and various other measures to help create self-sustainability in many of our communities and to address the long-term question of food security. In terms of the number of targeted beneficiaries and the number of feeding sites and these identified, it's quite a complex picture. There are certain beneficiaries which will be fed routinely, and then there's a lot of other beneficiaries who are coming and going. And the support we're providing is some of which is funding directly to CNDCs. And I'll hand over to Mr. Hewu in a sec to just talk about that. And then some of it is also funding that is being used by NGOs to provide to purchase bulk food supplies that is then being distributed to various satellite points and community kitchens at a very local level that is then being provided to them to help them provide for their beneficiaries. At the same time, the city of Cape Town has been providing many of these informal operations with cookware and equipment that help them to actually do that cooking work. So it's there's that element, and then there's also a food voucher program as well, where community kitchens are being provided with food vouchers that can be redeemed at spaza shops. So it's a mixed modalities, and then there are some also food parcels that are being kept by the department for people who are frail, who are unable to leave their homes, or who are living in remote areas that can't access a community kitchen. So there's a multiplicity of channels by which the food relief is being introduced into the different communities. But I'll ask Mr. Hewu to speak to the question about the number of feeding sites and CNDCs identified. Mr. Hewu, can you maybe assist?
Yes. Thank you, HOD. Once again, good morning, all members. Honorable Chair, through you, we have 104 Honorable Bagu feeding sites, which is Community Nutrition and Development Center sites, that are run by 51 NPOs. Yes, that is spread province-wide, and we've got at least in every municipal district or region of the department, we have a presence and we've got a footprint. The HOD has covered the numbers very well. In each of these sites, we feed at least 68 people. And with the support that we give to community kitchens, we're supporting more than 200,000 beneficiaries because each community kitchen supports a number of beneficiaries ranging between 50 and 250. So the coverage and the reach is very wide. And I think the question that Honorable Mackenzie is asking, I will then answer it later after the HOD has made his remarks, because it is also linked to food relief. Unless HOD will want me to proceed to the 25 million.
Yeah, please, if you can, Mr. Hewu.
Okay, thanks, HOD. Honorable Mackenzie, the 25 million that we have received, we are definitely going to use that using the format that we have tested and we have seen it working, where we use a combination of supported community kitchens, where we fund the NPOs to actually render these services in partnership with the Department of Social Development. And then there's organizations that we support, we fund, and then they then support, either buy dry food or give financial support to the kitchens so that they can buy food and cook for their beneficiaries. That is one intervention that we are going to continue with it. We've seen it, it is working. It is actually scaling up our intervention in addition to what we do in our daily feeding in the community nutrition and development centers. So we'll do that when our current funding now, out of the 51 million, in some instances it will run until September 2021. In some instances it will run until January, and in some instances it will run until March. So this 25 million and part thereof will then sustain that same service from the time when it is depleted due to the current funding, and then we'll then proceed to ensure that we sustain that intervention for the rest of 2021-22. That is the one part. The where we will continue with the same feeding sites, the same community kitchens. The list that we have provided to the standing committee will maintain the same list. Of course, when we talk about community kitchens, there are some that fall off due to certain occupational health and safety issues. Some fall off due to inability to account in terms of the proving the beneficiaries that they are feeding. Then we'll add new ones in those cases. Otherwise, by and large, the same kitchens, the same list that we've already provided to the standing committee, we will maintain that. The how part, I think it's covered, is supported to community nutrition and the community nutrition and development centers, where we feed from Monday to Friday. That we will maintain. And then the other one is community kitchens. Some feed for the rest of the week, Monday to Friday. Some feed 4 days a week. Some feed 3 days a week. But by and large, there's no community kitchen that is feeding less than 3 days a week. That is how we're going to deal with the how part, Honorable Mackenzie. I hope that suffices, HOD. Thank you.
Thank you very much, Mr. Ewo. I think to add to that, Chairperson, is that DSD's feeding schemes are one part of the puzzle. I think it also needs to be seen in the context of that the city of Cape Town, for example, has put so far just under 60 million rand into food relief as well in the metro area. Of approximately 55.8 million that the city has been put into vouchers for that can be redeemed at local shops. So it's quite a good supplement to what is going on at the province, because we've got this going on, as well as the Department of Economic Development and Tourism is also providing about 500 vouchers per month, which feed approximately a family for a month. And then of course there are the COVID grants as well. The city's vouchers, I think, are of 300 Rand value each, and they've issued 163,000 of those. So it's quite a big initiative alongside what the province is doing. The Department of Social Development also provides vouchers, or rather daily meals to children in the ECDs. So there's anywhere between 50 and 80,000 children who receive meals every day in the ECDs, and then there's up to 490,000 people or children who are being fed daily in the schools. That number has reduced a little bit because of the alternating arrangements in some of the schools, with children going in one week and not going in the other week, and so food parcels were also distributed to the families to try and support them by the education department. So between the city and the province, there's approximately 1 million people in this province who are benefiting from food support, and then the COVID grant is also benefiting about 400,000 people. So we're actually in a situation at the moment where a good 15% of the provincial population is currently receiving food relief from between the different spheres of government, which is a very significant level of support being rendered. And of course, that is also not the full picture, because there are also the EPWP programs that are being run that are also providing people an income opportunity so that they can avoid being in a situation of hunger. And then, of course, the NGO sector itself, using donor funds, is doing an enormous amount of work with food relief. So the province is actually very fortunate to have such an active civil society that is providing all of that support. And if anything, it is probably exceeding government's inputs. The Department of the Premier is working with the Department of Social Development at the moment to see if they can set up a tracking system so that we can actually get a consolidated set of information on all the food relief that is being provided in the province, which would give us a global picture of where the food relief is going and how much there is, and then also compare that with information on where there is malnutrition and a need for food relief. To make sure that we don't miss any areas, because it seems to me that there is a lot of food relief, but there are some areas that are not so accessible, and there may be gaps, and that's the challenge at this stage. In terms of the question around from Member Baku Foss about the number of temporary shelters available, how much budgeted for it, I will ask I think that the temporary shelters speaks to the shelters for victims of gender-based violence, if I'm not mistaken. So that would be, I would ask Liana Goosen maybe just to give a high-level detail on that. But I think if you want all of the specifics, that we may have to provide in writing. But I'll ask Ms. Goosen if she just wants to speak to the number of shelters available and the budget for that.
Thank you, HOD. In terms of, are we now talking victim empowerment shelters?
That was my understanding, yes, yes, Liana.
Yeah, over and above the new 6 that we have 19 shelters across the province. And in terms of the budget, there was 5 million allocated for the new shelters. I will maybe the CFO can just give us clarity on the other allocation, but we can provide the information in writing.
Thank you, Ms. Goosen. The total allocation for victim empowerment is in the budget, but some of that is for services other than shelters specifically. I don't know if CFO can give a breakdown now, or if Denver Holly can give a breakdown now.
For GBV.
HOD, sorry, yes, we will have to just work out that breakdown in terms of that. Thank you.
Thanks. Okay, thank you for that. And Mr. Jordan, do you have any inputs on that?
Yes, actually, just due to the fact that I worked with the program before. So the total budget is about 60 million rand for all of the EP, of which about 25 million rand goes just to the shelter specifically. Thanks.
Thank you very much. So the 25 million would then be increased to 30 million with the 6 additional sites approximately. But to give exact numbers, we would then probably be best to give that in writing, so that we can just break it down, because it's included in the overall budget for victim empowerment.
Actually,
yes?
Yes, sorry, it was 20, but it goes to 25 million with the extra 5 million.
Okay, understood. Thank you. Thank you very much. Also, that's a fairly close figure to what to answer that question, but we can provide a more detailed breakdown if the committee requires it. And then in terms of the question for the demand for psychosocial support services during 2021, and is it open to the public, and has the awareness been made of those services? The answer is that there's been a major spike in the demand for psychosocial support services during 2021. We don't have the final figures for the year yet because we're still in the year, but we have on 2 previous occasions presented to the standing committee with the figures for I think it was the first and second quarters last year, and the figures were way up in terms of the number of persons seeking psychosocial support services from the department. These are open to the general public, and we have on a number of occasions publicized that. But also, as the minister has mentioned, we do also have a partnership with the faith-based organizations that are also providing support to their various constituents as well. So it is a joint effort between government and civil society in that respect. I think the psychosocial support services that have been rendered, a lot of it has been around bereavement support for those people who've lost family members to COVID, but also trauma counseling for people who've been affected in other ways by the pandemic, including by the increase in certain forms of contact crime and gender-based violence during this time, and also the trauma of being infected and put into various institutional contexts has had an impact on people in isolation and quarantine and so forth. So there's been a lot of trauma and a lot of need for psychosocial support services. And of course, our own staff, as well as the staff, particularly in the Department of Health, have also needed a lot of support during this time because of what they've been through. The question from member Bakabaka Foss regarding page 297, the statistics on the children murdered and raped for the previous year. The statistics for the year are collected by the Department of Health's Child Death Review Panel. We haven't reached the end of this year yet, so we don't have those figures, but the Death Review Panel does have the figures for the previous year. So I would say that the question should probably be put to the Department of Health as a parliamentary question, so they can provide that information from their forensic what is it? The Child Death Review Panel falls under their mortuaries, so they would be able to provide that info. The rapes and assaults on children are also recorded by the Tutuzela centers where those cases come in, but also by the SAPS. But there has been, I think, in the past year, a slightly lower number of child murders than the previous year, which we think has got a lot to do with the lockdown. So we are seeing a lower number coming through, but we don't have the final tally for the year. But I think the main thing that has been driving the rates of child murder in this province is primarily gang violence. So we're getting a lot of under 18 children dying due to shooting incidents in gang conflict, as well as being caught in the crossfire of gang activity. And beyond that, there's also been quite a number of children who died due to being abandoned as babies, and that is something that I think was flagged a few years ago. So we, as a department, have put in place a strategy to boost child safety, with a particular emphasis on early warning systems. We've increasing the reach of the Eye on the Child program, which is designed to get community volunteers trained and networked to flag when they see children at risk in the community. Women in Rental Stock also offers a similar approach as well, surveillance for children and women at risk. And then there is also the increased budget this year that, as we mentioned earlier, 4 million additional has been put into child protection to expand particularly Eye on the Child and also community-based child and youth care services in the areas where additional LEAP officers are being deployed under the safety plan, so that we complement the criminal justice response with the child safety and welfare response. I think the other key issue with child protection is also the implementation of the electronic foster care system that we're going to start with in the new year, which will create some more efficiency in the way that children are tracked through the child protection system, and hopefully save some time for the social workers. But I think the biggest step really in this space is when if the Children's Amendment Bill can be passed, bringing in some changes around the way that foster care is dealt with, as well as the Social Assistance Act. When those two acts are amended, it will reduce the number of children coming through the foster care process to ensure that we don't have children going through the full investigation for child safety and going to the children's court just for the sake of getting a foster grant when they're being placed with a family member, and instead that those children can be placed and receive a child support top-up grant when they are being placed as orphans with family members, so that they don't have to go through the full child protection process. That will free up the social workers and the children's courts to focus on genuine child protection matters and be more thorough in the work they do, because they'll have smaller caseloads. So I think the key thing is, if you look at our figures, about 60% of our cases are made up of children being placed into foster care because they are in need of a foster grant being placed with a family member, as opposed to actually being children who are at risk that need childcare and protection services as contemplated in the Children's Act. So that is going to be a major benefit for our child protection system if it is implemented as intended, because it will enable us to actually focus our resources on children at risk and prevent child murders and child abuse much more effectively than we can at the moment. The question from Honourable Member Mackenzie about the child and youth care centres, have all services been transferred from BASASA? Yes, it is being fully transferred. So there's no, BASASA is not rendering any more services. The department is fully rendering all of those services that BASASA used to render, and we have no more contractual obligations towards BASASA. In terms of the details on the 25 million, I think Mr. Heer has spoken to that. But once all of that allocation is finalized and the different community kitchens that will be supported have been finalized, we would be able to then provide a breakdown for the committee of where the food relief is going. But it will be province-wide. So it's not just going to be in one in the metro or any one area. We're going to reach as far as possible, and we'll be looking to identify gaps between the where people are most in need and are not able to access any other support. In terms of the question of expansion of medical staff in our facilities, I'll ask Ms. Goosen just to speak to that briefly.
In terms of our child and youth care centres, there would be no expansion on our current staff because our total staff stayed stable. In terms of our services to Siwahili, there was an increase due to the fact that the numbers were increased. Currently, we are in a contract with a transversal contract with Department of Health, where we mostly use agency staff to provide that service, but we also have 8 internal health professionals rendering. In terms of our NPO CYCCs, they utilize the community-based healthcare services as they utilize schools, other community organizations for their services, except for those where we cater for, where we provide services to children with profound disabilities, where we fund certain healthcare positions. We also in partnership with the Department of Health in terms of the task team for children with behavioral challenges, as we are with the Department of Education. So that is a multi-stakeholder task team that address that. But in terms of direct service delivery, that's about the services.
Thank you, Ms. Wilson. You broke up a little bit there, but yeah, I think the expansion of medical staff is specifically for the children in the facilities, and so it's in-house nurses who can administer medicine to the children who are kept in the secure care centres that are run by the department. And then also we're partnering, of course, on the vaccine, as Ms. Wilson has mentioned, to get the vaccine rolled out in the facilities. The Sanitary Dignity Project, the question about the details of that project. The project is mostly targeting schools. In fact, it's only targeting girl children in schools at this stage. So there's quite a long list of schools. Maybe Mr. Ewo can just give the high level detail of that. Mr. Ewo, are you with us?
Chairperson, they can supply us with a list of schools. You don't have to read through it now. That's fine.
Okay. No, thanks, Chair. I'm okay with that as well.
Hey, Jody, I just ran out of the network a little bit, and I'm back online now. Mr. Mackenzie was talking about the list of the.
The question was relating to how many schools we're reaching with the Sanitary Dignity Project.
Yes. Thanks, Jody. I'm sorry about that. Honorable Mackenzie, we are looking at the same schools that we were providing since 2019-20, whose delivery took place during 2020. What we have done now, we have placed an advert. The tender is out now for the 10.5 million that we've got for the current year, for the new financial year. And we hope that we will still cover the 221 schools. And we are just hitting some hiccups with the Department of Education because there are about 31 schools that are no longer willing to participate. So we're waiting for the Department of Education to add those schools so that we proceed with the 221 schools so that we can reach the 94,000 girls. And the criteria will still the same criteria where we are these 21 schools are schools where they have experienced a high absenteeism rate of girls, and our assumption is due to the lack of sanitary towels for them. So we'll still support the same schools, hopefully 221 with the difference of about 20 to 30 schools. And the list, once it is completed, we will then share the list with the committee. Thank you so much.
Thank you very much, Mr. Ewo. And then the last question from Honourable Member Mackenzie related to the allocation of HIV/AIDS prevention programs and the details of that and whether we partner with Health and City of Cape Town. Just to say, we are part of the Provincial AIDS Council and also we do work with the Department of Health, although this particular project is a pilot, or not. I don't know if it's a pilot, but it's a particular flagship project that's been driven by the Deputy Minister relating to behaviour change and reduction of risk-taking behaviour among youth. So that project is an earmark allocation received from National Social Development for this particular type of project that deals with risk behaviour reduction. Thank you, Chair.
Thank you very much, Mr. McDonald. I've tried to make as many notes as well. Members, I'm going to ask that we now break for 5 minutes just to take a comfort break. I'm mindful of the fact that some colleagues have been sitting for a while, and then we'll come back at 10:02, so that's 9:50, and we'll resume with our program, and then we will move on to questions on pages 304 to 310 with your indulgence. Are we all in agreement with that?
That's fine, Chairperson.
Yes, Chairperson, that's fine. Thank you.
Perfect, members. So we'll stay in the meeting, but we will all just mute ourselves and take a quick comfort break and be back at 10:02.
Thank you.
Thank you. Members, before we broke, I saw Member Windvogel's hand was up, and I just want to check, Member Windvogel, if that is a follow-up, or you're happy for us to move over to pages 304 to 310?
Chairperson, it's not that I'm disrespecting your ruling, but there's two issues on the pages that we moved away from that is very close to my heart. And with your permission, I really want to ask those questions.
That's fine, Member Windvogel. Member Mackenzie, can you indicate if you have a specific follow-up?
Yes, Chairperson, I actually wanted to ask the same question. If we are going to move on first or just ask a follow-up question.
I'm just mindful of time and load shedding, but I will allow for a second bite of the cherry if members would like that. Member Windvogel has indicated that she's got two burning issues that are close to her heart. So do you also have questions on the pages 295 to 303 that we've just covered?
Chairperson, in the interest of time, I'll ask them as we go along, so I don't take more time. Thank you.
Okay, Member Windvogel, you may go ahead.
Thank you, Chairperson. Chairperson, mine is on page 297, paragraph 2. Point of reference, the Western Cape is a home to 2.4 million youth between the age of 15 and 34. Given this reality of many challenges affecting the youth in the province, why is the department not increasing the budget and expanding the scope of youth development? And is the department satisfied with the amount earmarked for youth development? And also, what programs are in place to address the youth challenges associated with the social pathologies listed in paragraph 2? Then the last one, Chair, is also on page 297, paragraph 3. What is the prevalence of COVID-19 at residential facilities in the province for old and people with disabilities? And what measures are put in place to prevent the spread of COVID-19 in these facilities, and how much is budgeted for it? Thank you so much, Chair.
Baie dankie, agbare Windvogel. HOD, ons gee oor na u, Dr. McDonald.
Thank you, Chairperson. In terms of the question of the no increase in the youth development space, I think the picture we're sitting with is that there's been very little increase anywhere, except the areas we mentioned, which were mostly in response to the COVID recovery. So unfortunately, this year, between the financial situation that the government finds itself in due to the reduced tax collection and the pressing issues that COVID has triggered around immediate material relief needs, those things have taken up the limited space for additional funding. So youth is in the same position as many of the other programs in the department of not receiving additional money, which is unfortunate. We're not happy with that, but we don't have a choice. Unfortunately, it's where we find ourselves right now. So no, we are not happy. We do have the youth cafes running, which have been set up over the last term. And those projects have continued. They've also tried to adapt as well to be able to function during COVID as best possible, given the often stringent lockdown requirements that were placed on gathering and indoor numbers of people indoors together. So that has been quite challenging for the youth cafes, but that is the main program in social development. However, the youth priority stretches across the province, so it's not only dealt with within social development. There is a focus area on, particularly on setting up a youth in service program for the province that is being spearheaded also under the Wellbeing and Dignity work stream. And that's looking at also the quite a few different options to assist youth, ranging from EPWP opportunities, the Chrysalis program, and the youth in service, and the Yebo Year Beyond program for schools, and the entire after school program space. So there is a lot of work around youth development in the province that is outside of social development. And so the youth side of things is certainly not limited to what is encapsulated in this budget for youth. The questions around the programs to address the various pathologies mentioned in paragraph 2 of page 297. I think the issue of if I understand the question correctly, the impact of the economic recession on jobs and so on. To some extent, that is addressed with the EPWP program. We have received extra money for EPWP in this financial year, both in terms of allocation and also in terms of incentive grant. And the same is true of many of the other departments in the province as well. So EPWP spending is increasing significantly in social development, but also across the rest of the province as well, which I think is one important measure. But I think also, again, has to be seen in the context of other programs too. I don't think, though, that we can say that these things are adequate given the scale of the challenges. And I certainly think that if we look at social development in general, the budget and the department are relatively small in relation to the scale of these challenges, which is why we are taking hands with the civil society organizations, the NGOs that we work with, and also the municipalities and the national sphere of government to try as far as possible to mitigate these things, particularly the massive youth unemployment crisis we're sitting with at the moment. I think, though, that it's a multi-agency job, and we have to work in partnerships to make it possible to actually address these things. I think also that there is an entire work stream in the province on jobs and economic growth, and that is focusing on increasing investment and increasing economic activity again in the wake of COVID, which will certainly have a positive impact on the issues listed there. So it's a holistic approach that the province is taking to this, of which social development programs are one part. In terms of the prevalence of COVID at older persons and disabled homes, we have been keeping weekly statistics on that, which we can share with the committee. Currently, we are at the lowest point we've been since since last year, after we had the second wave. So our current statistics at the moment are, I think we have around 37 cases across the province. But we can certainly provide all of that to the committee if the committee would like that information. Thank you, Chair.
Thank you very much, Dr. McDonald. Colleagues, I'm now going to ask for you to table your questions on pages 304 to 310. If you could give me an indication. I see Member Makamba Boycha and I see Member Mackenzie. But before we do, I see Minister Fernandez, your hand is also up. Do you want to add a response or do you have a question?
Chairperson, now I just want to alert yourself and the members that 2 or 3 of our staff are affected by load shedding and they have lost their connectivity just in terms of the availability. I thought I should alert you. Thank you.
Thank you very much, Minister. Yeah, we are all jumping in and out of different stages of load shedding. And I can't imagine how difficult it is for staff who are also based at facilities that are affected by load shedding. So as I said, members, the list that I see on my screen is Honorable Makamba Bocha, Honorable Windvogel, Honorable Philander, and then Honorable Mackenzie, in that order, please.
Thank you, Chairperson, and greetings to the meeting once again. My question is on page 309 under Program 1, under the title that says Changes, Policies, Structures, Services, Establishment, Geographic Distribution of Services. With regards to the infrastructure, the department speaks about the expansion of local offices and the maintenance, which is subject to the availability of suitable sites and funding thereof. So I've got 2 questions on that. One question is that, does the department speak about the expansion of local offices in the size of their space or in an increase of a number of offices? That's number 1. Number 2, if the answer there is an increase in the number of offices, how can then the department plan to expand its offices, but at the same time of the year, they have not identified suitable sites and whether the required funding is enough? Thank you, Chair.
Thank you very much, Member Makamba Bocha. Member Windvogel.
Thank you, Chairperson. Chairperson, mine is on page 313. Can you hear me, Chairperson?
Yes, I can.
Mine is on page 313, table 8.2. Sorry, earmarked allocation. Chair.
Sorry. Member Windvogel, can I just check? Did you say pages 313?
Yes.
Okay, thank you.
Thank you, Chair. Chair, my question on the sanitary and dignity project, whether there was any under expenditure in the budget for the sanitary dignity project last year, and whether all the sanitary towels from last year were distributed to girls. Secondly, Chair, what is the number of social workers that will be employed this year, and how much is the department spending from the conditional grants for this purpose? Then my last question is on 314, Chairperson, table 8.2.1, compensation of employees. If the department can provide clarity for the increase in compensation of employees when all other departments are cutting expenditure in this. Thank you, Chairperson.
Thank you very much, Member Windvogel. Member Philander.
Chairperson, thank you very much. Page 305, that refers to national and provincial priorities. Chair, I just want to make sure that is the page I'm just reading online. Can you confirm that is the heading of that page, 305?
I also have a digital version, so let me just scroll to it, sorry. I think some members are working off the blue books because they've been able to get their hands on those, but some of us are working off
Yes.
PDF. Member Philander, ask your question, Solang, and then we will find the page.
Okay, sure. Thank you, Chairperson. Chair, with regards to the Western Cape Provincial Strategic Plan, and the departmental outcomes, I see it makes mention of youth with regards to the DSD safety priority that makes reference to children and youth. I don't see women included there. Is there other program? Is it other way listed within the priority of DSD safety, Chairperson? If I can just be provided with clarity on that. Thank you.
Thank you very much. Member Mackenzie.
Thank you, Chairperson. two questions. One on the capacity building of social work, so page 310, and related professions. One is, given that many institutions were under lockdown, how did we train social workers and related professions? And then the second question to this particular point on capacitating of staff. And given that we're now load shedding and the CEO of Eskom said it's 5 years of load shedding, from the HOD, what is the department's plan to ensure officials are capacitated, whether they work from their homes or from social workers on the road, to ensure that they are not load shedding, cannot provide services? For example, now individuals can't log on because of load shedding. And the third question on the sanitary project, again on page 106. And Mr. Heu earlier on said that 21 schools did not participate. And I just trying to understand, why would schools not participate if they get free sanitary pads? And I've made a note to ask a parliamentary question there as well, Chair. Thank you.
Thank you very much, Member Mackenzie. I'm also going to take a question from Member Baku Force, because her hand went up in that round earlier. Member Baku Force, you may go ahead. Member Baku Force, are you still there? Okay. IT, I see my screen says Member Baku Force is on hold. So are you able to just assist the member to move from on hold to into the meeting? And whilst IT does that, I will hand over to the department to answer the round of questions. Thank you, Dr. McDonald and colleagues.
Thank you, Chair. Minister, would you like to say anything first?
Thank you, HOD. You may proceed. I'm covered. Thank you.
Thanks, Minister. The question from Honourable Member Botcher regarding the expansion of local offices, is the expansion relating to space or number of offices? I think in that context, it was relating to number of offices, but also there is sometimes space expansion as well. So the question is, why were we planning to expand offices, but suitable sites not yet identified and funding not yet identified? I think the fact is the department had a blueprint for this expansion of the department to try and reach local areas more effectively, and identified the areas where local offices were needed, and then begun to seek out space for those areas. And over the past 10 years, that has been implemented, and most of the local offices that were planned have been set up. However, there are always sites where it's a challenge to find a good space, and that is to do also with changes that have occurred over the past 10 years to the situation, because 10 years ago the province was in a much better financial situation than it is now, and the Department of Transport and Public Works had more funds available to assist with office maintenance, building maintenance, and also they were in a position to assist with renting of properties where required for departments. However, during that time, that has changed, and the Department of Transport and Public Works no longer has adequate funds to expand on its portfolio of maintenance work beyond what it already has to deal with, and also they are no longer willing to take over rentals for departments of new rentals, because they don't have funding anymore. So the impact of the financial situation on Department of Transport and Public Works has impacted our plans as well, in terms of reaching the targeted number of local offices we wanted to set up. Having said that, there are also some offices that are moving, for example, into shared services buildings and so forth. So it's excuse me. So it's a mixture of things. Some of the moves are still going to go ahead, and whereas others we're battling. Also, in some instances, we've had cases where suitable office space was identified, and then subsequently landlords have changed their mind or decided to try and extract a higher rental than is reasonable, and those kind of things also then result in office spaces that were planned falling through. So that does occur, and in some instances also we've had offices where the offices actually become uninhabitable due to infrastructure flaws. The Milnerton Office of Social Development, for example, for some reason the building in which we were in had a new section constructed on top of that the building that we were renting in, and it caused leakages in the building. The building work affected the integrity of the structure, and the leakages were so bad in the winter that a few inches of water accumulated on the floor of the offices, and we had to actually abandon those offices because they'd become uninhabitable. So there's always things happening like that which can affect our plans for opening up office spaces and so on. In terms of the question from Honourable Member Windvogel around the sanitary dignity program, yes, there was underspending during the financial year, where we actually surrendered some of the earmarked funding that we'd received. The reason for this was that the distribution of the sanitary pads was targeting schools, and the extended school closures during the course of last year and also in the beginning of this year greatly reduced the window for us to distribute those sanitary products to the girl learners. So instead of having the full year, 12 months to distribute, we were reduced to, I think, something like 8 months. So I think it's unfortunate, but it was completely unavoidable and unforeseeable, unfortunately. In terms of the number of social workers hired last year and what the plans are for this year, I'll ask Ms. van Reenen to speak to that.
Thank you, HOD. On our approved structure, we've got a total of 714 social worker posts across all units. We also have an additional on contract 142. 37 of those are funded from the earmark funding. Currently, we've got 70 vacancies, which are all in the recruitment and selection process. So we plan to keep those vacancies filled and make provision to have those additional 142 on our structures. Thank you, HOD.
Thank you very much, Ms. van Reenen. I think that also goes to the question that follows, which is why is there an increase in the total compensation of employees budget in our department, whereas most departments have been freezing or reducing those. I think Ms. van Reenen will also be able to assist with that question. Thank you.
I think in our department is the fact that we need to work with the social work ratio from 1 to 4,500, as well as in our child and youth care worker units. We struggle to fill some of the areas, in some of the areas, the post. So obviously the increase is as a result of need to have those additional post funded, and obviously if you look at the additional 2 centres, with those staff complements that was added to our structure to a total of 294 posts that was added. So that's the rationale for our COE that's increased.
Thanks, Ms. van Reenen. And that was, of course, following the takeover of those centres from BASASA, where we had to create 290 odd posts on our establishment newly. That we then needed to fill. We managed to fill most of those last year, but there was still some that we couldn't fill due to not all candidates being suitable for the posts. There's a lot of one of the big challenges with the BISASA takeover was that, first of all, we were not permitted to transfer the staff who were employed by BISASA straight from BISASA to social development. The Department of Public Service and Administration indicated that there must be a recruitment selection process, that they wouldn't allow for a direct transfer over of the staff. Secondly, also the public service entry requirements are different from the entry requirements that BISASA had. So that meant that some of the people that had been employed at BISASA would not be able to qualify for the posts in the department. So the basic requirements like having a matric were a blockage to some people being able to apply. Since they didn't have a matric and so were not able to then be qualified to apply and be interviewed. So that we are an unusual department in that sense because of that takeover. In terms of the question from Honourable Member Philander, the national and provincial priorities and the PSP safety focus on youth and children. The issue of women and gender-based violence is also set out, but it's in the well-being and dignity priority area at the moment. It does span both safety and well-being and dignity, but that's where it is at the moment. And I think the safety priority will certainly also be beneficial to the GBV issue because it's aimed at reducing all forms of contact crime in the areas where it's being implemented. So it certainly does benefit children, youth, and women. But the GBV priority actually sits with the well-being and dignity priority area. In terms of the questions from Honourable Mackenzie, the capacity building, how was training done during the lockdown, particularly for social service professionals? I'll ask Ms. van Rieenen to speak to that briefly.
Thank you, honourable members. Last year was really a huge struggle for us in terms of the capacity building for our staff. What we did is we looked at the programs that can be done online and is available online. So we managed to do a couple of those programs, but mostly the programs that is available online relates to, if I can call it, transversal generic training, for example, management training or meeting skills or those kind of trainings. The training specifically for social worker related that we could manage to do online was around the norms and standards for our social workers, as well as the supervision frameworks that was discussed, and a little bit of the training around the Children's Act. The other training that we struggle with, which is extremely difficult to online, is, for example, trauma debriefing. We've managed to train our GBV, so 30 additional GBV social workers on those specific trauma debriefing training skills. But those we had to divide into smaller groups, not to compromise all the COVID regulatory frameworks, because there's certain exercises that they need to practice to enable the facilitator to declare them competent in those skills. So we will continue in this year with the things that are online, which we can do, but unfortunately we'll also have to have the face-to-face training in much smaller groups to make sure that we capacitate our staff. Thank you, honourable members.
Thank you for that. And then the plan for service continuity in terms of load shedding. The departmental personnel have been provided with laptops and also tablets and other devices to assist them working in the field and also working remotely. We're now just distributing another batch of these devices. Those all have batteries, so it does help people work a little while into load shedding. And they also are equipped with 3G cards. But if load shedding takes out a server, the provincial government or the national CETA server or the internet service providers systems, then connectivity does get lost, as there is nothing really we can do about that. So load shedding is a major hurdle to what we have to do in terms of the administrative side of work. But on the flip side, a lot of the work that the department is doing doesn't necessarily rely on things like internet connectivity or having your systems up all the time, because a lot of the social work processes are person-to-person processes, and also working with the children's courts, working with facilities and so on. So it's not necessarily something that will cause the department to come to a halt, but for the administrative staff, it is a disruptor, unfortunately. In terms of schools participating in why the schools withdrew from the sanitary dignity project, I'll ask Mr. Hewa whether he can shed further light on that question.
Thank you, HOD. Through you, Chair. Honorable Mackenzie, it's not that the schools are refusing to participate. They participated in the last in the last distribution, but what they are saying is, because they are participating in other programs where they get sanitary dignity projects, they have asked that the Department of Education considers other schools that are not receiving anything. So that is the reason. But I think it's out of goodwill, and then to ensure that they are not selfish and take everything for themselves, but make sure that the benefits get distributed to other needy schools. So that's the point. I'm sorry I put it as if they are refusing. Thank you, Honorable Chair.
Thank you, Mr. Hewa. That is the questions I have. Thanks, Chair.
Thank you very much, Dr. McDonald. Member Baku Force, can we now go to your question? Member Baku Force, are you able to hear me? Okay, while we wait for Member Baku Force to respond, Member Barnes, welcome to the meeting.
Thank you, Chair, for the special welcome. I'm sure you've noted I'm also disappearing for quite some time. Apologies if I'm going to repeat the question that has been already asked, Chair, but I have a certain interest on the last answer that we got from the sanitary towels responded by Mr. Hewa. What I would want to know is what criteria is being used to choose the schools that they are giving the sanitary towels to. And then one question, Chair, since we are on page 313, that I wanted to know under table 8.2, the summary of payment estimates on social welfare. With regards to service to older persons, how much is used to prevent spread of COVID-19 in the old age homes? I thank you, Chair.
Thank you, Member Barnes. Colleagues, can I also ask before I hand over to the department that if there's any other questions on the sections dealing with page 304 to 310, that you can give me an indication now, because after that question has been answered, we're going to move on to pages 310 to 319. I see Mr. Hewa.
Thanks, Chair. There's a question from Member Von Vogel, HOD, about whether there was any understanding.
Yes, thanks, Mr. Hewa. We did respond to that already, Mr. Hewa.
Okay. Thank you. Thank you, Chair. Sorry about that.
No problem. Thanks.
Okay, Dr. McDonald, would you like to respond to the question posed by Member Barnes?
Sure, thanks, Chair. Yes, the choice of the schools for the Sanitary Dignity Project was based on absenteeism data of girl learners from the Department of Education. The project was envisaged nationally to try to address absenteeism in schools due to a lack of access to sanitary products. And so we then arranged to get an analysis from the Department of Education of where they are picking up higher rates of absenteeism of girl learners, and the schools with those highest rates were the ones were then targeted for the purposes of the Sanitary Dignity Project. We will then be able to track and see whether that has a positive impact on the absenteeism levels or not. Because if it doesn't, then we'd have to then relook at how best to use that project and see whether there's other ways to use it to achieve the outcomes intended. In terms of the question around how much was used to prevent the spread of COVID-19 in old age homes particularly, I will ask either Ms. Goosen or Mr. Jordan, because I know Mr. Jordan was dealing with it at the time, although he's no longer responsible, whether they can assist with that.
Thank you, HOD. Ms. Goosen has got connectivity issues on and off, so I will answer on behalf of her, and also that I was involved that time. So it is plus minus about 12 million rand we've spent on old age homes. So there's various kinds of submissions and funding we have provided. For old age homes, that included PPE, that also included relief staff from other NGOs to go and assist in old age homes. Also for nurses with regards to monitoring the protocols of COVID that has been developed between DSD and Health Department to actually ensure that those protocols are monitored. And then also where staff needed training in old age homes on COVID protocols, that they be trained in that. And this amount excludes all the private donations that was received from private companies who also provided PPEs to these old age homes. Thank you.
Thank you very much, Mr. Jordan. Thank you, Chair. That was the questions that we received.
Thank you very much, Dr. McDonald, as well as Mr. Jordan. I still see Member Bako Force's hand. Member Bako Force, are you with us? No, Member Barnes, is that a new hand?
No, Chair, I'm covered.
Okay. Colleagues, we're now going to move on to pages 310 to 319. Can I please get an indication if anybody has any questions on those sections? I see Member Makamba Boycha. You may go ahead, ma'am.
Thank you, Chairperson. Am I audible?
Loud and clear.
Okay, Chairperson, my question is on page, you said you want questions from page 313 to which page?
310 to 319, ma'am.
Okay. I've got three questions, Chairperson. One is from page 313, which is program 2 under the heading earmarked allocations with an amount of 54.4 million, which is allocated for the persons with disability for the year 2021-2022. Is the department in a position to give us an estimate of how many people in this province live with disabilities? Reason being that the department came up with the budget allocation for the disability grants. I'm not sure if it's for disability grants or whatever the case may be. So what I want to know, if there is a list so that we can know how many people with disabilities, and if there is any, how many needs assistance, and take into account those that might add to the existing number in the financial year. That's number one question. And number two, under Roman figure 2, there is a budget allocation of 15.7 million for the social worker employment grant. And in brackets, there is a written something like a conversion to PES. I don't know if it's PES or PS, but something like that. And what I want to know, what does that mean? does this mean that the money will be transferred to the NGOs who have social workers and that are also involved in the social services work? And what does the PES conversion mean? Number 3, on Roman point 4, the department speaks about the social work additions to sustain employment of social worker, particularly in areas with the high prevalence of gender-based violence, substance abuse, and issues of affecting children. Then the budget allocation there is 20.9 million. My question is then, is whether the department has identified these areas which it speaks about here, and how many social workers will be employed under the budget allocation. I understand some of the questions of some of the answers were provided in this particular question, but I've just need some more clarity. And then on page 316 on program 3, under the heading earmarked allocation, I'm concerned there because only 5.8 million is allocated for HIV prevention programs, like the social and behavioral changes programs for the year 2021-2022. So which programs are these and where do they take place? Also, with such a small budget for a very serious pandemic that continues to affect our people, who will be the target market for these programs? Because if these programs that take place in clinics, or are they going to take place in the hospitals, then that will also be a problem since not everyone will visit those areas in a given year, for an example. And then my last question is on page 319 under program 4, under the heading earmarked allocation of 17.8 million, which is allocated for social development related violence against women for the year 2021-2022. Number 1, which will this money be transferred to NGOs giving these services? And if so, how many will the NGOs exist in the province? And how much will each receive? And I remember this question was also asked where the department is requested to supply us with a number of NGOs. And the last one is also on the 5 million that is allocated as an increase to support families due to the impact of gender-based violence. So how many families does the department think will be assisted with such a small amount increase? And how does the department justify this small increase? Chairperson, thank you very much.
Thank you, Member Makamba Pocha. Member Mackenzie.
Thank you, Chairperson. Member Kanda Pocha took quite a bit, so I'll just have one or two. On access to the services, page 318, and I'm just going to name them: adults in conflict with the law as referred by the courts, children in conflict in the law as referred by the courts, children and youth at risk at these high risk areas. And this question would be for all those services listed on page 318, the outputs at the annual performance plan. Given that we've gone through various stages the last year, and obviously we don't know what's going to happen the next year, how are the services, how do people access these services? Because a lot of them are physical one-on-one services, as we know. And given, I mean, if you look at previous services that were provided, are we changing those services? Are we changing how people can access these services? And that'll be applicable to all those sections. Thank you, Chair.
Thank you very much, Member Mackenzie. Dr. McDonald, Minister Fernandez and team, I will now hand over to you.
We'll go straight to Dr. McDonald, Chairperson.
Thanks, Chairperson, the Minister. So the first question from Honourable Member Bocha was how many people in the province live with disabilities? And the question of with the 54 million budget allocation and what it is for. Is it for grants? I think just to say, first of all, there is information from Stats SA on disabilities, and maybe I shall ask Ms. Siham to see if she can assist us maybe with that. I know it's probably information, or maybe Mr. Jordan, either Mr. Jordan or Ms. Siham Niftakhadin. But Mr. Jordan can go ahead first and to give us his input on that.
Thank you, HED. The estimation of people living with disabilities in South Africa and worldwide is estimated usually at 15%. So if you look at the Western Cape province with census data and community survey data, we're talking of an estimation of about 800,000 people. The issue, however, with the censuses is that they also do include people in censuses that say that they need glasses to read. So I personally feel that that information from census is not always 100% accurate. But if we look at the population that we serve in the Western Cape, the department serves at least 100,000 people living with disabilities and their families. The 54 million rand that's been earmarked has been used specifically for subsidizing the homes for the disabled. It has also been providing about a total of about 200 social workers in the disability sector for Deaf South Africa, for Alzheimer's, for cerebral palsy, for autism, for all of those kinds of pathologies in the disability sector, so that social workers in the sector can actually support the families and the individuals with and the people living with disabilities with these kinds of disabilities. Part of the 54 million rand is also for specific projects such as the disability court case, which is about the right to education for children with intellectual disabilities. So quite a lot of money has been plowed into that project and program specifically for children with intellectual disabilities. That program would involve support to these children and adults living with intellectual disabilities, such as OT services, health services, transport, for them to access also protective workshops, for them to access centers where they actually are being stimulated with various kinds of programs for their mental stability. So that's basically where all the money is going to. Thank you.
Thank you very much, Mr. Jordan. The disability grants, of course, are paid by SASSA, not social development. The question relating to the social work employment grant, what does the conversion to PES mean? That was originally a grant from national government directly to the province for social worker employment. And it has now been converted to the provincial equitable share. So it's no longer a conditional grant. It is now part of the equitable share. And so therefore it doesn't require reporting on as a conditional grant on a monthly basis to the national department or the National Treasury. It's now been what one might call mainstreamed into the social development's budget. So all those social workers that were employed using that conditional grant, and now that they're all employed, the money is now being shifted to the department's ordinary equitable share budget. That is part of our main compensation budget now. So those social workers and the cost of employing them has now become part of our normal budget as opposed to being a conditional grant. That's what it refers to. These posts are not in the NGO sector, they're posts within the department itself, as social workers employed by the department. In terms of the question around social workers being deployed to areas where there's high levels of GBV, the 20.9 million. Has the department identified these areas? Yes, the department has done so. We have deployed the social workers. I'll ask Ms. van Rienen just to elaborate on that and just give the number. Ms. van Rienen, can you assist with that?
Certainly, honourable members, we had the additional 30 earmark fund that we received for the appointment of the GBV social workers. We've got 2 of those officials is working at head office to drive the program from head office. In Cape Winelands Overberg, we've got 4. Eden Karoo, we've got 5. Metro East got 5, and Metro North and Metro South has got 5. And then in the West Coast region, we've got 4. I can provide the details specifically in which STAs they are working if needed. Thank you.
Thank you very much, Ms. van Reeden. The question relating to the earmarked allocation of 5.8 million for HIV/AIDS, that's an earmarked allocation, so that's not the full amount that the department puts into that. That is a particular amount that is ring-fenced from the national government for a particular program that addresses behavioral change that's targeted at youth. However, again, that it's got to be seen in the context of all the projects and programs, the other projects and programs run in the Department of Social Development for HIV/AIDS, and also the main driver of the response to HIV/AIDS, which is, of course, the Department of Health, which has many billions assigned to this function. So the majority of prevention programs fall within the Department of Health. This particular project was initiated by the National Deputy Minister of Social Development and is being driven in the Department of Social Development as a support, but the Department of Health is the main player in that respect. It's the target or the project is being driven. It's not being driven in clinics. It's being driven through NGOs working in communities with young people. In terms of the earmarked allocations for gender-based violence, and whether the money is going to be transferred to NGOs, yes, that funding will be going to NGOs. The breakdown of the NGOs and how much they will receive, we can provide the committee with, bearing in mind that the amounts for GBV are the earmarked allocation is one amount, but there's a lot more. So that section deals with earmarked allocations, which are particular amounts above and over and above the existing amounts. The 5 million that's been earmarked there is only an addition to, and that specifically speaks to, if I'm not mistaken, the shelters, but maybe the Chief Director, Ms. Wilson, or the CFO can just clarify that. I think Ms. Wilson's having connectivity issues, so maybe I'll just ask the CFO if he can just speak to that 5 million earmarked.
Thank you. Is Mr. Joan in the meeting still? I see Mr. Jordan's hand is also up.
Actually, would it be okay if I give feedback on that?
Yeah, you can do so on behalf of Ms. Wilson.
Yeah, because she's still got connectivity problems. Yes, the 5 million rand is actually being used for various kinds of things. It's earmarked funding we've received from previous years as well. The earmarked funding has been specifically provided for subsidies of bed spaces, for additional bed spaces. It's also looking at stage 1 shelters during COVID. It was also being earmarked for security upgrades at shelters. Then also specifically for funding social workers and house mothers, specifically at some of the shelters. Before, we never funded the house mothers, but only social workers. So the house mothers are being funded as well by our department. Then a portion of the money also goes for skills development for women at the shelters, to empower them as women to gain extra skills so they can become independent if they have to return back to the community and actually obtain jobs through that kind of process. Then also some of the money goes to other organizations, such as Rape Crisis, for their projects, for the interventions, assisting women with court cases, interdicts, and all of those kinds of stuff. Thank you.
Thank you very
much. Sorry, Chairperson. There was one last question from Honourable Member Mackenzie, which I can assist with if the Chair would like me to.
Yes, please.
Okay, thank you. The question was relating to page 318, the services relating to adults and children in conflict with the law referred by courts, children in conflict with the law receiving the probation diversion services. The question was, how do people access these services? These services are triggered by criminal justice procedures. So where adults or children are arrested by the SAPS, and charged, then in the case of children, when SAPS arrest children, they need to bring in a social work professional from the Department of Social Development in the form of a probation officer, who, in terms of the Child Justice Act, then works with the SAPS and prosecutors around an appropriate way of dealing with that child. Some of the children are sentenced to our secure care facilities. Some of the children are put into diversion programs, so they don't have to be put into custodial sentence care. And some of the children's cases are also converted into Children's Act placements as children at risk or children with behavioral challenges, and they're also placed into secure care, but not in a sentence capacity. The adults in conflict with the law, it's a different process. The adults, when arrested, social development is not necessarily involved at that point, but if the prosecutors of the view that the person may be eligible for a diversion program, then they will engage the services of the department's probation officers, who work with the prosecutors and the courts to then arrange for a person who's been charged but who is potentially a candidate because of the crime not being of a serious nature to be diverted into a program that they then complete. And if they complete that program, then they are able to avoid a custodial sentence. So accessing those services is only through the criminal justice process, through arrests and involvement of the courts and prosecutors, and social development is then brought into those processes. Thank you, Chair.
Thank you very much, Dr. McDonald, as well as to Mr. Jordan for those responses. Colleagues, we're now going to move to, before we do, I see Member Makamba Boycha's hand just went up as I looked down. Member Makamba Boycha?
My hand was up long time ago.
Are you back, Member Baku Force? Member Baku Force, can we just take the follow-up question from Member Makamba Boycha, and then we'll come to you. We couldn't hear anything that you were saying while we were calling out to you. Member Makamba Boycha, do you have a follow-up? It doesn't seem that Member Makamba Boycha has a follow-up. Member Baku Force, do you want to go ahead?
Chairperson, I was muted. My apologies. I do have a follow-up.
Okay.
Yeah, with regards to the HIV prevention programs, I did not hear the response on one of the questions that I've asked pertaining to the areas where these programs are being held. Like, for an example, I know for a fact that in most cases they're being done in clinics and hospitals, and we know for a fact because of the pandemic, not everybody goes to the hospital. It's like a no-go area. So what I want to know, what other areas does the department offer this kind of programs with regards to the 5 million that is allocated for such? Thank you.
Okay. Member Baku Force, do you want to ask your question now, please?
Yes, sir.
Okay, you may go ahead.
Thank you, Chair. My question is in page 331, table 8.2.4.
Sorry, can you just repeat the page number again, please?
331, Chair.
We're not there yet, though. We're not on 331. We're currently on pages 310 to 319.
Let's go to 318 then.
Go ahead.
The table 8.4. I want to know, how is the increased budget for substance prevention going to assist in the fight against the drugs and substance abuse challenges in communities? And the last one, Chair, is still on 318 in table 8.4 still. What is the total budget for GBV and prevention of violence against women? And what are the details of funded activities? What are the plans to open for victim empowerment centers in the working class communities where majority of victims reside? And what progress has been made in this regard? Thank you, Chair.
Thank you, Member Baku Force. Member Mackenzie, can I ask, do you have a follow-up, or is it something that can be addressed when we move to pages 320 to 330?
It's just a follow-up, Chairperson. I think perhaps I didn't ask the question properly on the question I asked, and I just want to rephrase it for Dr. McDonald.
Okay, go ahead and rephrase.
Yeah, perhaps I didn't ask the question properly on 318. Now, we know those individuals were referred by the courts, the adults in conflict with the law, the children in conflict with the law. What I'm trying to understand is when they were referred to you by the courts, was there a problem in implementing some of those diversion programs, whether it's for adults in conflict with the law, whether in children in conflict with the law, or in youth and children, youth in high-risk area? That's what I'm trying to understand. Thank you.
Thank you very much. Dr. McDonald, I'll hand over to you and the team.
Thank you, Chairperson. The question firstly about the areas or where the HIV/AIDS programs are offered, I'll ask Mr. Jordan maybe to provide a little bit more detail on that.
Thank you, HOD. Yes, so the funds for the HIV/AIDS, as the HOD has alluded before, is predominantly for preventative and intervention work. And the NGOs that we fund to render this service is specifically also for psychosocial support to people affected and infected with HIV/AIDS. So we do cover the whole province. There's about 25 NGOs that assist us specifically. So it is from City of Cape Town's area. It is in Citrusdal, West Coast. It is in Drakensberg area. It is in George area. It basically covers the whole province. But if required, then we can provide the full list. I actually have the list in front of me. Thank you.
Thanks, Mr. Jordan. Then in terms of the question on page 318 from Honourable Member Baku Force, the increased budget for substance abuse programs, how it will assist. The substance abuse programs are primarily the drug treatment programs, which are run across the province. So they provide a combination of inpatient or residential treatment as well as outpatient or community-based treatment services. So those services aim at helping people recover from addiction, but there's also early intervention services that are provided, particularly also we're targeting younger people who are beginning to experiment and getting into risky situations with substance abuse. And then there is reintegration and post-intervention support. So those services are really designed to assist people with a continuum of services that address the level of risk that the clients are in terms of their substance use disorders, and we fund a number of NGOs to run those services as well as provide those services ourselves in some of our residential facilities. So it's a combination of NGO and social development rendered services, and of course our social workers in our local offices are also providing the early intervention and also aftercare and reintegration services. So that amount that is reflected there is for all of those types of services. But I don't know whether Ms. Corson would like to add to that if she is on, considering that it is her within her budget. But I don't know if she can hear us at this point. Ms. Corson, are you on? it doesn't seem like okay. But yeah, we can certainly provide the committee with a full breakdown of how that funding is going to be utilized, because look, it's a nominal increase year on year, and from what we had in the previous year, but that it looks like a bigger increase than it actually is, because the total appropriation last year was 112 million. It's now 113 million. There was a reduction last year because of during the lockdown period, some funds were shifted away because some of the treatment centres were not operational, particularly the outpatient community-based programs. Were not able to operate during the lockdown period, so there were savings there. So the actual amount isn't really a big increase year on year. It's only an increase of R500,000 rand, but the increase is because we're now back to running full services this year. So that's I hope that assists. And then the question about from Honourable Member Baku Force about the total budget for GBV, that is the budget that sits within victim empowerment services. So the total amount this year is 65.8 million for the financial year for gender-based violence in the Department of Social Development. But there are, of course, activities in other departments that also contribute to this objective, particularly quite significant amounts in the Department of Health for tutors, ALS centres, and then there are, of course, all the work that's being done in community safety around watching briefs for GBV cases, and also the other spheres, the SAPs and justice sectors. So there is actually a significant amount of funds going into that space over and above what you're seeing here. So yeah, that's that side of things. And then from Honourable Mackenzie, the question about when cases are referred to social development, are there problems with implementing diversion programs? During the lockdown, there have been problems. I don't know whether, I think Ms. Corson is still locked out, but she, otherwise, I mean, I can just state that within the year, there were some diversion programs that had to go on hold during the lockdown periods, but also we at all times, we always do have a percentage of people who don't complete the diversion programs and that have to be referred back to the courts for further measures. So there is a problem of some people not attending consistently, and then they have to deal with the consequences of doing that. And then sometimes there are also valid reasons, sometimes when the people have challenges around transport to get to the programs and so on. But implementation was somewhat disrupted during the last year because of the lockdown, and also some of the courts closed as well and only dealt with very urgent, serious matters. So a lot of the diversion and probation type cases were put onto the back burner as well as a result of that. Thank you, Chair.
Thank you, Dr. McDonald. I haven't asked any questions, so perhaps I can take the liberty of just asking a follow-up before we move on. The funding for the diversion programs, does that come from the Department of Justice and Correctional Services, or does it come from national directly or out of the provincial equitable share?
Thank you, Chairperson. As an aside, I just got a request from Ms. Corson if someone can let her into the meeting again. She's in the lobby. She's saying she can't get in. But the funding for diversion programs, no, that doesn't come from the national sphere. It's in that sense, we allocate funds from our equitable share to that. So the diversion programs that we run are either run by our own social workers from the local offices, or they are run by the NGOs that we fund. So it's a combination of that, and we fund that with our money. The probation services can be a little bit confusing because we have probation officers who do the probation reports for the pre-sentencing reports, and also they do the work of managing the people who have been put into diversion programs, and they do the case management of that and write up the report for the court on the completion of the diversion programs or otherwise. But in terms of the people who are released from sentences on probation or parole, that function is rendered by the Department of Correctional Services, and they have their own officers who deal with that, and they pay for that with their budget. So that's a separate thing. But for the diversion programs that are preventing people from going deeper into the criminal justice system, that we fund. Thank you, Chair.
Thank you, Dr. McDonald. So just for clarity, irrespective of you not knowing at the beginning of the financial year how many diversion cases are going to be sent to the department from the court, you're still able to fund that, and that all comes from the provincial allocation, and no funding comes from any other national department for those diversion programs.
Chairperson, that's correct. We usually base our projections and funding of those programs on the year-to-year statistics. So if we've had a certain trend of number of cases coming through to us, generally that trend stays fairly steady, and we budget accordingly. But if we ever get a spike in cases where we need to deal with more cases than usual, then we would have to look at allocating some additional funds, but we haven't run into that kind of problem yet.
Thank you very much, Dr. McDonald. I must say I really admire you and your team and this entire ministry and your ability to make things happen without sometimes having the information available that helps you. Colleagues, we're now going to move over to pages 320 all the way to 339. That includes all of the annexures. Please may I get an indication of which colleagues would like to ask any questions? I see Member Mackenzie. Can I get an indication? Any other colleagues? Member Barnes will go after Member Mackenzie. And while we wait, Member Mackenzie, you may go ahead.
Thank you, Chair. Thank you, Chairperson. On page 320-21, which is also under vulnerable person or youth skill development programs on 321, and it's also related to my earlier question, but it's specific on this page. Those that could not get to diversion programs for whatever reason, transport, trains, ports were closed, etc. Is there a plan in place to start dealing with that in the coming year, particularly on the youth at risk? And if we can get a list, I've made a note to ask the Chair as well, of those 11 high risk areas. And then, Chairperson, on page 300, page 327, I just want to get an understanding on the consultants and professional services. For the main appropriation, it was 944,000. Then it jumps to 3 million rand, and I see in the coming years is back to 938,000 again. What is caused that massive increase in the adjusted appropriation, and what was that for? Similarly, at the second line, agency and outsourced services, 39 million, then on the adjusted to 22 million, and I see it's going back to 26 million. And then below that, on consumable supplies, 7 million, then it jumped to 14 million, and I see the years coming is going to be 12 million. And then page 3. Okay, that will give me an indication of the sub-programs under that, so I'll leave that as well. Thank you, Chair.
Thank you, Member Mackenzie. Member Yanda Barnes.
Thank you, Chair. My question is on the expenditure trends. On page 321, the decrease of 63 million in the revised budget of 154 million in 2020-2021 year function. to 91 million in 2021-2022 is due to once-off COVID food relief and EPWP funding in 2021. Now, what I want to know is whether the department believes that there remains serious need for continued food relief, or why is the department not engaging the Treasury for more funds, even if they are taken from the reserves? My second question, Chair, is on food relief function shift on page 322 on our earmarked allocation. Are these foods or the parcels aimed for cooking meals, or how many food parcels will be distributed from this earmarked allocation on food relief function shift? Thank you, Chair.
Thank you, Member Barnes. Dr. McDonald, I'll hand over to you and the team.
Thank you, Chairperson. The question from Honourable Member Mackenzie about the funding of transport to diversion programs. I'm not, at this stage, we're not in a position to add any funding for that kind of thing, but I will ask if she's in yet, Ms. Goosen, to advise on how they do try to assist where possible with people who are struggling to attend diversion.
Can you hear me?
I can hear you.
Okay. In terms of, as you rightly said, HOD, we cannot expand. So where possible, we have spread the services to the closest to the community. So the service providers move to the communities where this service are delivered, although we still have to accredit the program and the venue in terms of the diversion legislation. And then alternatively, the social workers or the probation officers or the our agencies that deliver the services on our behalf collects the people, especially the children. In terms of adults, they will have to use their own transport because they agree to this diversion and the costing.
Thanks, Ms. Goosen. The question regarding consultants on page 327, why did it jump to 3 million last year and then back to 944,000 this year? Also the question about agency and outsourced services, the shift between 26 and 29 million. And the other shift, I'll ask the CFO maybe if you can assist with that.
Thank you, HOD, thank you, Chair. Yes, in terms of the decrease for the consultants and professionals, this is mainly due to our projects that has ended in this program. So that mainly was the 3 million for the adjusted budget of this year. So there's some of those projects that have been finalized, and those projects now ended, and then we go back to the 938 in this case for our new budget in terms of our NPO services. And then for the agency and support, the outsource from 22 million to 26. It's all about our nutrition services, now full capacity. So we're basically budgeting now for full capacity going into the new year in terms of that. Is that it? Is that it, HOD, I think? Or...
Yes, thank you, CFO. The next question was from Honourable Member Barnes relating to the decrease of 154 million to 91 million. Regarding the food relief side of things and so on. I think first of all it should be noted that we received a once-off allocation from National Treasury of 51 million. And also we did some internal reprioritization of funding during the course of the year last year towards food relief. The bulk of the pressure on the department around food relief actually occurred before SASSA introduced the COVID grant. So there was a very severe pressure on the department during that time because the SASA had also exhausted its social relief of distress funding, and a lot of people coming forward looking for social relief of distress funds were unable to access those, and so they then turned to social development for assistance and also to the local municipalities for assistance. So it was very important for us to get funds available quickly last year to assist to avoid severe hunger. The reduction to 91 million is not therefore a reduction in real terms. In fact, we still got 25 million additional this year from the provincial treasury for food relief that we hadn't got in previous years' budget. So our amount for food relief still remains much higher than it has been in the years before that, and it is therefore still receiving a lot of resources. We also, as I mentioned before, we did receive extra money as well for EPWP. But I think the issue is that last year we did get a lot of extra money, and that will be watched during the course of this year, because if there is a need, we will then begin to bring in extra funds. Provincial Treasury has indicated to us that if we do need additional money, that they will assist. But also bearing in mind that the 51 million that we received from National Treasury for food relief, we only received it in January. Because it came in the adjustment, and that money is being allocated now in this month. And it's a lot of money that we've put into the NGO sector that will assist for a number of months to come into the new financial year. So that 154 million hasn't all been exhausted. It's in the system into the rolling over into the new year, and that money will therefore probably cover as much as half of the next financial year as well, before we even need to start using the 25 million extra we got this year. So there is some extra money that the Treasury said they will help us with if we do get to later in the new financial year and find ourselves needing more money. But at this stage, we believe that we will have enough to at least get us closer to the adjustment, and then if we do need extra money, we will then ask Treasury to give us that extra money for that purpose. But we do think that at this point, given also that the COVID grants have been extended at SASA, that we and also given that the city of Cape Town has received a very large additional amount of money from the German Development Bank for food relief, that we should be able to cover the bulk of their needs at this stage. But also the challenge is making sure we get the food to the right places, and that requires management, and it requires planning and information, which and not necessarily just more money. So I think the other point is that if the COVID relief grant is not continued, we'll have probably quite a serious problem, because the COVID grant in the Western Cape alone was reaching 400,000 beneficiaries, which is about 140 million a month. That was being injected into the economy of the Western Cape by SASA. If that funding stops, the amount of money we have will not come anywhere close to actually addressing the gap that's left behind. So for us, it's really critical that SASA continues with that until the worst of the COVID impact on the economy has passed. Otherwise, the poor are going to suffer severely. Even if we do bring some extra money from our side, it's just nowhere near. We'd have to use our entire budget as a department for that purpose. In terms of the function shift, the food relief function shift, the funds were specifically shifted to the province from National Department of Social Development, so that we can take over funding a number of community nutrition development centers that National DSD used to fund, but they now wanted the provinces to take over funding, because National DSD doesn't necessarily have the capacity to manage all this funding in all 9 provinces. So they've started up a project of funding CNDCs nationally, and they decided that they need to actually give that money to provinces to carry on with the funding because they are battling to coordinate all of it. So we've received a certain amount for to take over the funding of CNDCs that were nationally funded in this province, which we have duly implemented. And that's what that amount is for, and that's specifically for sites that are providing cook meals to the public. Thank you, Chair. See the CFO's hands up. Apologies, Chair. Maybe the CFO wants to add to that.
Yes, please. Mr. Smith, you may go ahead.
Thank you, Chair. Thank you, HUD. Yeah, I don't want to add to that, if I may, but I think I've skipped one question from Honourable Mackenzie, and that was about the consumable supplies that went from 14 million to 12 million. And the reason for that reduction is basically now that we work from home, our photocopy paper usage has reduced in terms of that mainly. Thank you. Thank you, Chair.
Thank you very much, CFO. And thank you very much to the members for your questions, as well as to the department for the responses. Members, I want to give an opportunity to the Black Sash to also ask some questions. If I can get an indication from the Black Sash, Ms. Edelman, and also any other member of the public, if you have any questions, if you could please just let me know by either raising your hand or just putting your camera on and then raising your hand. And then I see Member Barnes, your hand is up. Can I ask if that is a follow-up? And I see Member Mackenzie, you have lit up as well. Are you able to indicate whether that is a follow-up as well?
Yes, Chair, can I just do a quick follow-up?
Follow-up.
Member Barnes and Member Mackenzie, I'm going to allow you to do a very quick follow-up before the load shedding schedule cuts our meeting off.
Okay, first one, Chair. I just want to know if I can safely conclude to say that the budget that we are left with is going straight to the CNDC. And then my second follow-up that I want to know is, with the additional money that we are left with, I heard that the City of Cape Town has got a chunk of the amount. What I want to know, if maybe the department can just give us how it was geographically spread. Did it reach all regions, and how much each region got? Because I can only hear that the City of Cape Town got a certain amount that was a chunk of the budget. If I can just be clarified on that. Thank you, Chair.
Thank you, Member Mackenzie.
Thank you, Chair. Just as a follow-up question, if we can just get a report on how many cases was referred to the courts and the cost implications of that. And then, Chairperson, I have to say just a thank you to the Department of Social Development. With the recent gang killings in Mitchells Plain, they've been extraordinary. The officials came out, they were on point, and I have to give credit to them for the support they provided to those families. Thank you very much.
Thank you very much, Member Mackenzie and Member Barnes. Dr. McDonald and the CFO, would you like to respond to those?
Thank you very much, Chairperson. The budget, the amount that, the transfer of food relief function, yes, that money is all going straight to the CNDCs. Then secondly, the question on the City of Cape Town, maybe I didn't articulate the response clearly, but we haven't given any money to the City of Cape Town. The City of Cape Town received its own money that it got partly from its own budgets, but also from the German Development Bank. They've received quite a large amount of money for food relief that was donated by Germany. So what we were saying is that from social development side, we are able to then focus on areas that the city is not covering. So some of those areas will be in the city, but also there's a lot of focus on the non-metro areas. The City of Cape Town didn't receive any funds from the Department of Social Development in the province for food relief. They got that money through other sources. So we have put money into the metro area, but we've also put a lot of focus on the non-metro areas because they're not receiving the benefit of the money that the city has received to help with food relief. On the question from Honourable Member Mackenzie, the report on how many cases referred to the courts and the cost, is this with reference, Chair, through you to the court cases that the department's involved with? I wasn't quite sure which the context of that question. Sorry.
Member Mackenzie, there's a question of clarity to you. Are you referring to cases referred by the court for diversion programs or
Yes, Chairperson.
Available?
Yes, Chairman, as per page 318 that we were asking questions on earlier on, and one can respect the confidentiality of some of the individual's name, and I don't want the names of the person, but one has to see at least what's happening with the cases,
Yeah, Chair, through you, we can certainly provide those numbers. They are actually in our annual report as well. But the cases of cases coming to us from the courts, we have all that statistics. So if the committee would like that information, we're more than happy to provide it.
Thank you very much. We are going to schedule, colleagues, another meeting where we discuss the annual performance plan, and then we also have still the annual report season coming up as well. I also just note that the CFO's hand is still up. I'm not sure if Mr. Smith would like to add to anything.
Sorry, apologies, Chairperson. It was an old end. Sorry.
Thank you very much. Colleagues, I'm now going to give an opportunity to Ms. Edelman from the Black Sash to ask a question or make any inputs, which the department will have an opportunity to respond to. And once the department responds, I will also then ask the Minister and the HOD if they could also just get ready to make brief closing remarks before we excuse them and move on to the committee's business. Ms. Edelman, over to you.
Chair, thank you. No questions from our side, just 2 comments. Firstly, we'd understood from SASSA Western Cape that they were going to be providing updated figures on the temporary disability grant crisis to this meeting. And so we were kind of hoping for those. And so had not prepared questions around the specific agenda for this meeting. But we do want to just commend the Department of Social Development in the province for the work that they have been doing at this difficult time, and to share Dr. McDonald's concern about the impact of there not being an extension to the COVID grant. We will in April be launching a report on the impact of the COVID grant, and just that will highlight exactly the concerns that Dr. McDonald raised. We are also beginning to look at the link between social assistance and nutrition, particularly for children. And so look forward to engaging with this committee and with other colleagues on that in the future. So it was really just a bit of an input from me rather than a question. I understand time is tight, so I'm not going to say any further, but thank you, Chair.
Thank you very much, ma'am. And we actually really enjoy your input, and we do enjoy the reports that you put out because they're very helpful. And this committee has resolved to also work closely with the Black Sash because you've been at the forefront of representing SASSA recipients. SASSA presented to us about 2 weeks ago, and I'd be happy to email you that report. We do have some follow-up engagements with them as well. It is difficult to get information from them and to get that information on time, but we have been promised that they've turned over a new leaf with the current interim leadership in the Western Cape. Colleagues, I'm now going to hand over to Minister Fernandez and the HOD if they would like to make some very brief closing remarks so that we can move over to our committee business before load shedding hits at 12 in most of our areas.
Thank you, Chairperson, honourable members and guests, for a very robust yet dignified engagement. Chairperson, it would be remiss of me not to express my concern at the dire economic situation that this country finds itself in, And this is evidenced in the shrinking budgets, not only in this province, but in other provinces and at a national level. And there are two key dates that we need to keep an eye on, because as you would have heard, social development is a very complex department with lots of programs and sub-programs. But the two key dates for me are the 30th of April, and that is when the Social Relief of Distress 350 grant is terminated. National Treasury could not find money to go beyond that. And that will leave, as Dr. MacDonald has said, another 400,000 beneficiaries in this province out of pocket. The other deadline is that of the 31st of January, which is the deadline for the temporary disability grant beneficiaries to be medically assessed and evaluated. Now, as you might know, we have some 52,000 beneficiaries. SASSA had presented a 10-point plan, which I thought was aspirational at most. And they had indicated they would meet the objective or the goal of assessing all 52,000. Sadly, our meeting on Monday, we normally have a fortnightly meeting with SASSA, was postponed due to the AG coming into their business. So they have now sent me a note to confirm that our next meeting with them will be on the 29th of March. And that is really cutting it fine, because the deadline for temporary disability grants is the 31st of January. And we know that with a limited number of doctors, they have not been able to get to assess all the beneficiaries. And I have not had any feedback from the National Department indicating what the way forward is, and we are already on the 18th of the month. So that is a concern which could have an impact on the province, and we might then need to regroup in terms of our recovery plan, especially with the focus on well-being, which is where food aid to food security sits, and all the other related components. Chairperson, as with society at whole, our department has also been affected by COVID. We have lost colleagues during this last reporting period, and I sadly would like to take this opportunity to extend my condolences to all those staff members who have lost a colleague. Our most recent is our manager in the Central Karoo district, Ms. Carol Bernardi, who passed on 2 days ago. So we have a team that is hurting, yet they have to go out there and assist wounded, injured, traumatized individuals. And being a small team, it is important that we practice our values. We do the trauma support, the caring that is required. And often our offices or our services are interrupted due to a possible COVID scare, and that does have an impact on the community. And then finally, Chairperson, in closing, I must express my thanks to Dr. MacDonald for his very capable leadership, but to our entire team, to every single one of the nearly 2,500 individuals who work in Team DSD, especially in the Social Worker Month. We celebrated Social Work Day on the 16th, as you said, and I want to thank the team for their dedication, their commitment, their care, and actually going out there and responding to the need. And the need is great, and we are a small number. However, I must express my thanks to our NPOs, civil society, faith-based organizations, and everyone else who supports us. So this is not government who has a silver bullet. We are starting to see greater synergies and collaboration happening in terms of public-private partnerships, because the country is in economic distress, and the outer years, the cuts are going to be even worse. So I just want to caution that as much as we would like to reach every single citizen. Most of our work is vested in programs. We have 41 officers across the province. And then, of course, we have our NPO officers who act as referrals for individuals to access services. But to Dr. MacDonald and the team, as I said, thank you, colleagues. It was robust. We are now prepared for the next round of questions. And to you, Chairperson, and the honourable members, and Ms. Edelman from Black Sash, thank you for your kind words. It is appreciated, and we can only do this if we collaborate and we work together to create that impact on the ground for the most vulnerable in our society. Thank you, Chair.
Thank you, Minister. Thank you very much. Dr. MacDonald, is there anything you'd like to add before we say thank you to the department and all the colleagues from the department?
I think just to echo the Minister's appreciation to the Chair and the committee for the engagement, and also to thank the Minister for her leadership and support to the team. And thank you very much to my colleagues for all of their hard work in getting the budget finalized and ready for the new financial year. I think it's going to be a very hard year, and I'm sure we're going to see further adjustments during the course of the year, because the environment remains extremely uncertain, and we don't know when the next waves of COVID will come, but we expect that will probably impact our operations again. So we have to be ready and on our toes. Thank you, Chair.
Thank you very much, Dr. MacDonald. And also on behalf of this committee, thank you to you and the Minister, as well as all of the colleagues in the senior management team and across the board in DSD for the hard work that you've put in to get us to the third adjustment budget for 2021, and also preparing the budget for the next financial year, especially since we don't know what the challenges are that lie ahead and when we'll be able to all see each other face to face again. We really appreciate the work you do, and our condolences to the family of all those within the DSD family that have been affected by death and by COVID-19. And specifically, our condolences and our thoughts are with the family of Miss Carol Bernardi, who has passed. We thank you for your time, and we appreciate all the hard work. I also want to say thank you to our guests, Ms. Edelman, on behalf of the Black Sash here today. We appreciate your work as well, and we wish you all very well as you head into the next few weeks, and we hope that you do get to enjoy some time with your families over the Easter period as well. So colleagues from the Department of Social Development, as well as the guests, we're going to give you a minute or so just to leave the meeting, and the committee members will stay behind, where we will just complete some of our administrative business as well. Thank you very much.
Thank you, Chair. Thank you, colleagues.
Thank you, Chair. Thank you, everybody. Good afternoon. Good
Thank
morning.
you.
Thank you, Chair. Thank you, everybody.
Bye, everyone.
Colleagues, I'd like to ask if there are any committee resolutions or actions that you have, that you please write those down and you send them to Ms. Nomonde Jamche by the end of today. And if there's any requests for more information, that you also do that. And that is on the third adjustments appropriation, as well as any requests for information that you have on the budget that's been presented. Member Windvogel, I see your hand.
Oh, sorry, Chair. No, I think you covered me because I do have, I need more information on certain issues. But you advise us to send an email to the procedural officer. So I will do that. Thank you, Chairperson.
Perfect. Thank you very much, Member Windvogel. Member Baku Force, I see your hand as well.
Yes, Chair. Because I'm not sure if maybe it's on my side. I've been raising my hand. I wanted to ask the question that I asked before, 331, but you didn't give me a chance to do that. But as you are saying, I will send the message or email to Nomonde.
Yes, I'm very sorry about that, Member Bakubako Force. I did not see your hand on my side. It did not come up, it only came up now. But if you can put that question in writing, we'll make sure that once it gets to Nomonde, we'll get the department to answer it. And we should have an answer written, and it can be discussed at our next engagement when we meet again. Members, we're now going to move on to the adoption of our draft committee report. And this is the report of the Standing Committee on Social Development on vote 7, social development in the schedule to the Western Cape Third Adjustments Appropriation Bill for the 2020-2021 financial year, B3 2021. And this report is dated 18th of March 2021. The report, the proposal is that the Standing Committee on Social Development, having deliberated the subject of vote 7,
That I am a permanent member in this committee.
I can confirm your account of how it happens. Member Makamba Bocha is a permanent member of the Standing Committee on Social Development. That was 80'd. Member Brunkhuis is an alternate member. So Member Makamba Bocha can vote, and Member Brunkhuis is the alternate member from the smaller opposition parties. Members, then...
Sorry, Chair, on that matter. I'm not sure if that I know that in the previous meeting that is something that you raised, the Chair, and it was something that was discussed maybe, but unfortunately that decision cannot be the members, cannot be a decision of this committee. If the committee, if there's such agreement, if there is an agreement between Member Makamba Bocha and Member Brunkhuis in terms of membership, then that needs to be ATC. It needs to be ATC, and for now I have not seen any ATC that states that the member Makamba is a permanent member and Member Brunkhuis is an additional member. We even request an ATC from the tabling staff, if I remember, Chairperson, and you have that copy, and that ATC clearly shows that Member Brunkhuis is still a member of the committee and Member Makamba is an additional, which is that thing needs to be addressed now with the tabling staff so that there can be ATC, but it cannot just be the decision of the committee, unfortunately.
That's fine, Nomonde, and that's something that myself, Member Makamba Bocha, and Member Brunkhuis will sort out with the Programming Authority. But it has been changed on the website as well. So maybe that's something that the WCPP tabling staff needs to sort out, but we will speak to the Chief Whip as well as to the Programming Authority on that. Colleagues, I'm going to get just back to the item on our agenda, which is the adoption of the report. Can I then please just reread the report with your permission?
Yes,
the committee report will then read that this is a report of the Standing Committee on Social Development on vote 7, social development in the schedule to the Western Cape Third Adjustments Appropriation Bill, B3 of 2021, dated 18 March 2021. The Standing Committee on Social Development, having deliberated on the subject of vote 7, social development in the schedule to the Western Cape Third Adjustments Appropriation Bill, financial year 2020-2021, B3 of 2021, referred to the committee in accordance with Standing Rule 188, reports that the committee supports the vote. Minority view, in accordance with Standing Rule 90, the African National Congress expressed its minority view to not support the vote. Members, can I have a proposer and a seconder for the report as I have read it and as it appears on your screen?
Chairperson.
Proposed, Chair.
Thank you very much, Member Philander. Member Baku Force, I see your hand. Member Van.
Thank you, Chairperson. Chair, just a point of clarity. So are we excluding the EFF and Member Brangay's for support or not support the budget from this vote? I just need clarity on that. Thank you, Chair.
No, we are not. The only thing that we're doing now is the ANC was the only party that expressed a minority view.
And the EFF, Chairperson.
And the EFF, but until we clarify the membership of the EFF and
no problem.
Al-Jamaa, I think it would be safe if we only include the African National Congress for now as someone that's expressed a minority view. Baku Force. I think I heard Member Baku Force.
Yes.
I said not supporting, Chair.
Member Baku Force does not support. So then, members, our report will then read that the Standing Committee on Social Development, having deliberated on the subject of Vote 7, Social Development, in the schedule to the Western Cape Appropriation Bill B4 2021, referred to the committee in accordance with Standing Rule 188, reports that the committee supports the vote, but a minority view is registered. So in accordance with the Standing Rule 90, the African National Congress expressed its minority view not to support the vote. Members, may I again please have a proposer and a seconder? Member Makamba Boycha, I see your hand.
Sure, President, just before we get to that space of adopting the report, can we then also make a note that the whole thing will be pending until such time the matter at hand has been finalized in terms of the membership between myself and Member Brinkhuis, so that it can be edited after it has been rectified?
I don't think we have the authority, Member Makamba Boycha, to decide on where members are deployed. That is within the competency of the programming authority and with Parliament and political parties. So let's not make this report pending any decisions that those competent bodies need to take. We can only make decisions within which the rules allow us to do as the Committee on Social Development. So what I would propose for that situation is that between yourself and Member Brinkhuis, you engage with the Chief Whip, and I'm happy to participate if you need me to as well, where we can just get that 80 seat correctly, because there is agreement that the EFF is the permanent member and that Al-Jamaa is an alternate member on this committee. Is that in order with you, Member Makamba Boycha?
It's noted, Chairperson, but I'm also very worried that we will not reflect on the report because of this administration error that is taking place. So I'm very concerned with that particular aspect, that we will not be reflecting anywhere on the report.
I do understand that, and I understand your point of view, but just for the purposes of getting our work done today, that's the only proposal I see going forward. Nomonde and Mr. Daza, do you have any thoughts or procedural advice on that?
Chairman, thank you very much. No, from my side, I agree with you on Nomonde. You're correct. Until we have a revised ATC, we are working on the ATC that was last sent to members, and you are correct. It's only the Rules Committee that can make that determination. So we need a revised ATC in terms of the membership of committees.
as it should be, because the ATCs are not listed according to their names. It's just the date, because I was trying to look for the latest ATC on membership. But members, moving forward, can I please ask again for a proposer to adopt the report as it is on the screen? Member Mackenzie and Member Philander, are you still happy to propose and second?
Propose, Chairperson.
Thank you very much. So the report will then read that the...
Where's Mr. Mackenzie, Chair? There was no second, Chairperson.
I am still reading the report, Member Van Vogel. May I continue reading, Member Van Vogel?
You are welcome, Chair.
Thank you. So the draft committee report, or the report will read, the report on the Standing Committee on Social Development on vote 7, Social Development 2021, dated 18th March 2021, as follows: that the Standing Committee on Social Development, having deliberated on the subject of vote 7, Social Development, in the schedule to the Western Cape Appropriation Bill B4 2021, referred to the Standing Committee in accordance with Standing Rule 188, reports that it supports the vote. Minority view, in accordance with Standing Rule 90, the African National Congress expresses a minority view not to support the vote, and that has been proposed by Member Philander. And I'm sorry that I'm struggling to read. It's just that there's a cursor that's moving on the screen that I'm trying to follow as well. And Member Mackenzie, are you still there, or have you dropped off? You were seconding that proposal?
Yes, Chair.
Thank you very much. So it is proposed by Member Mackenzie, by Member Philander, and seconded by Member Mackenzie. This committee report is then...
I also second, Chair. I second.
Thank you, Member Brunkhuis. We've got Member Mackenzie already noted. Members, with that, that is the end of our committee business for today. As we are going into the budget season, we're going to be quite busy, but we will try, and as soon as we get a program for the rest of the parliamentary calendar, we're going to try and get all of our dates for all of our other activities sorted. We also still need to deal with the annual performance plan, because a lot of the questions and the decisions we've made now is listed in here. Member Mackenzie, I see your hand.
Chair, do you have one more item under general or not?
I don't have an item on general, but I was going to ask or give members some feedback on a decision that we made in the last meeting, but you can go
no
with
problem.
an item.
Sorry, Chair, I just wanted to put something on this committee at short notice. The Health and Social and Premier Committee is going on the 13th to the 16th, going to visit facilities during that period, membership earlier on, and I see 98% of the people are members of the Social Committee that is going on that visit from the 13th to the 16th. And I wanted to propose there's an Effective Families in Mossel Bay, a facility that I always, that I keep on raising in one or two committees, how good they are with looking after children. If you members of that, like I said, it's short notice, I've just thought about it now. If members would object to Social Development Committee.
Can you give us the dates, Member Mackenzie?
That's the 13th to the 16th of April. So the Premier Committee and then the Health is going there. But members of this committee, Member Bosma, yourself, Member Makamba Boycha, Member Brunke is a member of either the Premier Committee or Health Committee. And I thought, seeing that they are going to be there, that is Social Development, obviously led by yourself, could also do one or two visits during that period.
Okay, colleagues, are there any thoughts or input on that invitation to members of the Standing Committee on Social Development by Member Mackenzie? Member Baku Force? Sorry, ma'am, can you just repeat that?
I was saying, what are you saying, Chair?
I'm asking if you'd like to go with Member Mackenzie and Member Philander as the Premier and Health Committee on the 13th to the 16th of April. They are going to visit health facilities as well as projects that the Premier's department funds. And they've asked if this committee would like to go along to also perhaps visit some social development projects and facilities in the Southern Cape, so Mossel Bay, George, Knysna area.
I will be part of it.
Chair, sorry, Chair.
Yes, I remember. Case.
I don't have a problem of going with. I am fine with going with also. Thank you.
Chair,
Okay.
I also support the initiative. Thanks for the invitation, Member Mackenzie. Thank you.
Thank you, members. So what we will then do is myself, Member Mackenzie and Namonde and the other procedural officers will look at what are some of the facilities that we could possibly visit, and we'll look at Mackenzie's idea of visiting the facility in Mossel Bay. So we will put that into action. Colleagues, just an update as well. I have received so far 2 inputs from colleagues on items for the workshop. And that's from Member Makamba Boycha as well as Member Mackenzie. We are looking at doing this workshop from the 3rd to the 5th of May, and it will be a joint workshop with the Standing Committee on Education. And we're going to communicate those by the end of this week. Send me any ideas or suggestions you have for what you'd like us to cover before we close.
Thank you, Chair. If my memory serves me well, I remember you said we will do, but you are quiet about it. The standing committee and okay.
I'm not. I don't think you were in the last meeting. Member Van Vogel asked about this as well. It is on our agenda. Yes, we were just waiting for the dated parliamentary program.
Oh, okay.
Are you okay with us having that meeting once we come back from the constituency period? Sorry, Member Baku, of course I can't hear you. If you can just move closer.
Yes, my leader.
Perfect. So we will then put that on for once we come back from the constituency period, and that is the meeting on the CPOA old age home closures. Colleagues, is there anything else before we close? Honourable
Yes,
you've lit up as well?
Voorsitter, so ek wil jou compliment hier. Dankie, Chairperson.
Baie dankie. Ek is baie honger soos ek hier sit. Ek wil so graag.
I concur.
Dit is altyd baie lekker om met julle saam te ontmoet. And I actually can't wait to see you all in person because there's a lot of you I haven't seen. So thank you, Member Mackenzie, for that wonderful idea. Colleagues, that's the end of our meeting today. I want to say thank you very much to Namonde and for Ben for the hard work that you've done in putting all of this together. It's always very tight when it comes to budget. Also, thank you very much to Clarence and all of the colleagues at the WCPP's IT department for making sure that we were able to continue meeting even as people drop off. Please enjoy yourselves today. For those of you like me who in 1 minute will be sitting in the dark with no kettle to drink my coffee, please enjoy yourselves. The meeting is adjourned.
Thanks, Chair.
Thank you. Bye-bye.